we have the defense, and I'm going to introduce the panelists, and I'll begin with myself. Okay, so my name is Pamela Hanapwa. I'm the Dean of the School of Liberal and Performing Arts, and I'll be chairing the session. We are privileged to have Dr. Albert Luswata from Uganda Matters University, who is our independent reader of the dissertation. Dr. Luswata, you're most welcome. And on the panel, we have Professor Rukoko from the Department of Philosophy. Professor Rukoko, just wave, not everybody in the audience knows you. We have Dr. Christine Mpiangu from the Department of Religion and Peace. We have Dr. SRHR from Development Studies, who will be joining us shortly. Dr. Edgar Taylor from the Department of History will also be joining us shortly. But in the house, we have Dr. Lawrence Branco Sekalega from the Department of Performing Arts and Film, Dr. Martin Chamanywa from the Department of Development Studies, and Dr. Dominic Makwa from the Department of Performing Arts and Film. I would also like, in a special way, to recognize the presence of Ms. Mwanga's parents. They are with us in the house. So parents, again, you're most welcome, and thank you for supporting Mastullah. And now I would like to very quickly take us through the guidelines of the procedure. The candidate will be given 30 minutes within which to speak to us about her work. And in this, we hope that she'll be able to capture the background to the study, statement of the problem, the objectives of the study, the theoretical framework, the significance of the study, the research methodology, major findings, and conclusions and recommendations. The independent reader will have up to 60 minutes to engage with the candidate, and thereafter the members of the panel have up to 30 minutes to ask the candidate questions, and then the public has 20 minutes, after which the panel will retreat to take a decision and then return and announce. So without further ado, I will hand over to you, Mastullah, to take us through your work. Over to you, Mastullah.
Thank you so much, Dr. Pamela. Thank you, the panelists and the attendees for this great opportunity to present my PhD thesis. I also thank my parents for being around to give me this incredible support. My research topic, as you've seen, is the impact of polygamous marriages on women's realization of sexual and reproductive health and rights. And I looked at the case study of Uganda. First and foremost, this study explores the intersection between polygamous marriage structures and women's access to sexual and reproductive health in Uganda. The available statistics show that polygamy is prevalent in majorly Muslim and cultural setups in Uganda, occupying over 28% of the marriages in Uganda. And again, still the available literature shows that 11% of the married women in Uganda are in polygamous setups. I employed the liberal feminist theory and socialist theory to assess that while polygamy is often justified culturally and also religiously, the lived experiences of women in such unions usually reveals instances where there is unequal power dynamics, limited access to family planning, access to contraceptives, and of course, increased vulnerability to things like, or challenges like sexual and gender-based violence. One thing that you have to know about this study is that it seeks to fill the knowledge gap by examining how these dynamics specifically affect women's sexual and reproductive health and rights. My research problem is to the effect that a significant proportion of women in polygamous marriages face unique challenges. And the key word here is unique challenges. Of course, all women face challenges, but still within a vulnerable group, there is always a much more vulnerable group. So among the married women, women who live in polygamous marriages are much more vulnerable, hence facing a significant proportion of unique challenges. And these range from cultural and religious connotations that hinder their ability to exercise sexual and reproductive health and rights. My research objective broadly, or the main research objective, was to investigate how polygamous marital structures influence women's ability to access and realize sexual and reproductive health. I had 3 key questions, and the first is what are the legal provisions and their practical application pertaining to sexual and reproductive health in Uganda? Then the second, how does polygamy undermine the realization of sexual and reproductive health of women in Uganda? Then what are the good practices that might be of policy relevancy to improving sexual and reproductive health of women and men in Uganda? I used a mixed methods approach, and in this I combined qualitative interviews with women in polygamous marriages. I also had key informant interviews with health professionals and key stakeholders, and then of course, being that it was a mixed methods approach, I also had the quantitative analysis of the data that I collected. One thing you have to know is that the triangulation of this data enabled me to do a deeper understanding of both the individual experiences of the women in polygamous marriages, and also broadly looked at the SRH trends in regard to women who live in polygamous setups. The findings, for example, from at least 3 selected areas show that 0.1%, 0.3, and also 0.1%, for example, of women who were in polygamous marriages were in position to use the female condom out of all the study population that I'll be sharing with you. And then again, still when I looked at when you look at the findings from the respondents that I interacted with, I had Cardicot judges, and out of the Cardicot judges that I interviewed, 0.1% had knowledge about sexual and reproductive health and rights. The major findings show that there are still existing legal and policy gaps, which are also coupled with conservative interpretation of Islamic teachings. And definitely this restricts women's access to sexual and reproductive health and rights. Then also the other finding is in terms of access to health services. The study found disparities in access to family planning services among co-wives. Usually the young one would be either favored or less favored. And here the hierarchy of women mattered a lot, because there are instances where I found the young woman, or rather the young women or the young wives, being given priority. And still again on access to health services, if I can share some statistics from 3 selected study areas, 79.4%, 67.4%, and 81.3% lack access to information about contraceptives. Then also the other major finding is in regard to impact of the social-cultural norms. 53.3%, 48.4%, and 40.5% of the respondents had been subjected to marital rape, at least in 3 different study areas. This study concludes that polygamous marriages are currently practiced in Uganda, and they often undermine women's access to sexual and reproductive health, which makes them more vulnerable to health risks, and general human rights violations still exist. I go ahead and make recommendations, and where I push for policies that include the voices of women in polygamous marriages, and also empower the Cardicot judges, because they're the people, or they're the stakeholders who hear the cases that go to Cadi courts in regard to women, specifically the Muslim women who are in search of access to sexual and reproductive health. I also made an assessment and came out with what contribution does this study bring. This study, first of all, offers insights that could inform the academia, the policy, legal, and advocacy efforts, all of which are aimed at improving the well-being of women in polygamous unions. So by way of flow, my presentation, I'll look at the pitch, which I just shared with you. Then I'll also share with you the background and the area of study, why I did this study in terms of the motivation, the conceptual model, or framework, then my objectives and research questions, the methodology. Then I'll conclude and propose a framework. So like I stated earlier in my introduction, polygamy, it's a Greek word, and I don't want to go so much into details of this, but it's a Greek word, and a Greek word which means polygamous, and it means often marrying, like people who often marry. And this is not only limited to men. Polygamy is in two forms, polygamy and rather polygyny and polyandry. Of course, some people will be asking why I'm using polygamy instead of polygyny. My research is looking at the number of women or wives that are married to one man. But when you look at the available research literature, all authors, or majority of authors, maybe that's a better word, majority of authors prefer to go for polygamy as opposed to using polygyny. Of course, there are also patriarchal challenges there. It is important to note that polygamy is present at least in 78% of the world's cultures. I've already highlighted that in Uganda, it occupies 28% of the marriages we have in Uganda, and specifically 11% of the women in polygamous marriages. It is illegal in some countries like the United States, but still, even when it is illegal, for example, in the United States, men are allowed, or even women, you can go ahead and have any multiple partners. And specifically in Africa, at least 20 to 30% among or per 100 married men, you'll find at least at least per 100 married men, you'll find 20 or to 30% of polygamous men. In Uganda, it's permissible and or institutionalized culturally, and also legally, but also religiously. By way of definition, sexual and reproductive health is definitely, it is broad. It is not just the absence of disease like some people would think. It is a state of complete physical, mental, and social well-being. But at the same time, you also you may want to know that it involves having access to things like accurate information, sexual education, and services that promote health and respectful behavior. I did this study in 8 districts, as you can see on my screen here. Mukono, Buyikwe, Gomba, na Mayingo, Mayuge, Jinja, Iganga, and Arua as my case studies. And like I shared earlier, I aimed at contributing to greater understanding of SRH in the communities which are predominantly Muslims. Whereas Muslims is so prevalent in this study, I did not only look at Muslim women, I looked at communities that are predominantly occupied by Muslims. And one key thing that stood out in these communities that even the Christians, for example, and all the other faiths that live in such areas in the Muslim predominant communities also behave and conduct themselves like they are Muslims. Why I did this study, I think for me, what motivated me to do this study, first of all, I'm a Muslim woman, and I've grown up in Muslim communities, studied in Muslim communities, but also worked in Muslim communities, and also done literature review and research and seen what is happening in society. So, and I am aware that polygamy, like I've stated earlier, that is actually provided for within Uganda's culture and religious and legal system. So for me, this drove me, especially after doing the literature review and coming up to see that there are actually gaps that exist in terms of the legal framework, but also in terms of practices, access to reproductive healthcare. So this drove me into doing this research for purposes of producing knowledge that could actually contribute to the intersectional knowledge production of gender, religion, health, but also more broadly to the sustainable development goals. Like I shared earlier, that one thing that comes out from sexual and reproductive health and rights of women in polygamous marriages, first of all, I wish to clearly state that all women have challenges of accessing sexual and reproductive health and rights. But what makes women in polygamous marriages more vulnerable is the fact that there are unique challenges that these women face that a woman in monogamous marriages might not necessarily face. There are also societal attitudes, and wrong religious interpretations which perpetuate gender inequalities. As we go along, you will realize that, for example, a religion like Islam provides for sexual and reproductive health access, but still there are, the wrong interpretations, the stereotypes that surround reproductive health cannot allow women in such polygamous setups to enjoy their rights. My conceptual framework, as you can see on your screens, polygamy is influenced by, structural factors, as you can see here: culture, religion, poverty, gender, economic status. And but also one thing that you need to know about polygamous marriages is that in marriage, there are perceived benefits and barriers, severe abuse of rights, for example, and many women are usually susceptible to these abuses. Most women usually will seek health services, but still there are challenges that impede access to such services, things like availability, the affordability. Are these women in position to afford these services? But again, if they are in position to afford, are they in position to, are the services themselves available to these women? Acceptability, usually all these affect these women when it comes to seeking proper health care. Many women generally, as you may be aware, in polygamous marriages, they have not been able to utilize family planning services. Like I shared earlier, there are always challenges with things like HIV services, and general health care. Therefore, this has led to increased maternal mortality, birth complications, anemia, HIV, and sexually transmitted disease, infections, and infant mortality. I had 3 objectives. One, to critically assess the legal provisions and their practical application pertaining to sexual and reproductive health in Uganda. Then my second objective was to assess the impact of polygamy on the realization of sexual and reproductive health and rights of women in Uganda. And lastly, I investigated the available measures and the good practices that might be of relevancy to improving sexual and reproductive health of men and women in polygamous marriages. I had 3 research questions. What are the legal provisions and their practical application pertaining to SRH? I will not repeat this because I shared with you earlier. And in any case, they are a replica of what the objectives are. In terms of my theoretical framework, I used 2 theories, and in this case, liberal feminism and the socialist theory, to help me understand how the multiple identities, including gender, marital status, socio-economic status, like how all these multiple identities intersect to shape the experience of women in polygamous marriages, particularly in accessing to sexual and reproductive health. In my research, polygamy, of course, is the independent variable in this case, and SRHR is the independent, rather the dependent variable. So I used the liberal and socialist theory to help me understand how these identities intersect with each other. I don't want to repeat again so much, but maybe I could say something about the socialist theory and how it really applies to my work. First of all, it explores how women in polygamous marriages may face barriers to accessing SRH. Things like family planning that I'm discussing today, maternal health care, and education. Therefore, in my study, I try to highlight all these barriers, just like you saw in my conceptual framework. The research emphasizes that access to health services is actually a social right that must be upheld. And for me, when I did the analysis, I thought that the social rights theory and liberal feminist theory were the best theories to help me understand my study. I looked at quite a number of available literature, but I was also very intentional and focused on qualitative narratives, anecdotal evidence, which all resulted into scarcity of qualitative data. Of course, there's all of us on this call will agree with me that yes, people have written about sexual and reproductive health. People have also written about polygamy. But one thing that is very key in the available literature is the fact that there is insufficient empirical research that explores the difference in sexual and reproductive health among women who are in polygamous marriages across the different regions of Uganda. As you saw me sharing with you my context and scope of study, I looked at 8 districts within Uganda. So there's not so much research that gives you this intersection and then again goes ahead to look at Muslim communities, but also goes ahead to look at the different 8 districts. There are also gaps in the existing laws, things like the Customary Marriages Act, and also the Mohammedan Act. Just 2 years ago, when I was still doing this research, somebody went to court and sued the Attorney General of Uganda he contended against, I think, Section 5 that allowed the registration of marriages of minors in Islam. So these gaps for me drove me into doing this research. Then in my methodology, of course, my methodology was informed by the different philosophical assumptions, aware that any choice of research method is mostly influenced by major philosophical considerations, which is ontology and epistemology, which underlie the research process. Therefore, these 2 positions of philosophical positions of ontology and epistemology helped me at least to go down and do a critical analysis and element in the design of the research and come out with what kind of research methods would I use. And I ended up zeroing for a mixed methodology. So in this research, and maybe to just again say a little more, I ended up doing a mixed methodology, which I will speak about later, and in this case being quantitative and qualitative research methodology, but I'll share details later. My research paradigm, this research or study is so much inclined to the pragmatism school of thought. Why? Because it was a combination of interpretivism and positivism. Though so much inclined to interpretism, because it's not so much of the. I have a quantitative component in my research. Yes, there is that objectivity, but there's also a lot of subjectivity in my research. It's only on objective 2 where I bring out the objectivity part of it and try to show some statistics what is happening to women in accessing sexual and reproductive health and rights. I just mentioned a few minutes ago that I had a mixed methods approach, whereby both qualitative and quantitative approaches were used for this study. And as I stated, the study was inclined so much to qualitative school of thought. Why did I go for qualitative? First of all, of course, qualitative has, like far greater, ability with feminist, studies, but also as a standpoint than qualitative. But like I have said on my objective 2, I had to bring out some statistics. And again, as you're already aware that qualitative research can still be best explained by rather quantitative research can best be explained by qualitative research, hence the two methods of research. I had 232 respondents who were selected for this study, 142 female, of course, 142 because the research focused on women. And out of the 142, 90 were male, 130 were polygamous women in polygamy, rather, and then 12 were women in monogamy. I did this wasn't a comparative study, but it was important that I bring in at least to just see what happens in monogamy so that I do not come like to a conclusion of claiming that, women in polygamous marriages have unique challenges, yet actually it could be maybe the same challenges across board. I had 80 polygamous men and 10 monogamous men. And of the 232 respondents who had received the questionnaires, I went ahead and did, again, detailed interviews with 124. One thing you have to know is that of the 232 respondents, 124, all the 124 were subjected to focus group discussions. And all these men who were all the respondents who participated in this study, I have a quote here, all these men claimed that the Muslims claimed that they're practicing polygamy because it is provided for within Islam, but at the same time, they are African men. And those who are not Muslims claimed that they are practicing polygamy because they are African men, giving the presumption that, African men are supposed to be polygamous. I had a total of 16 focus group discussions, and every focus group discussion had at least 5 to 7 respondents. I had non-Muslim women and Muslim women, like I stated earlier. But for me, my study was looking at the Muslimness of the polygamists of the women who are in polygamous setups in Muslim majority communities. And again, one thing also that came up, for example, from focus group discussion is the fact that even the non-Muslim women described their husbands as though they were Muslims, or they described them Islamically. Therefore, a total of 30 respondents accepted to give case stories about their experiences. This having been a mixed methods research, I did also do document review. As document review to collect some secondary data. In terms of the sampling techniques that I used for this study.
Mastullah, 10 minutes. So just be aware, you have about 10 minutes. Yeah.
Okay. I think okay. I think I'll take you straight, since I've spoken about my methodology. I don't want to go into the nitty-gritties of I think it is more that I say something about how I validated my data. One thing that was very key, all my instruments that I used in the field, I reviewed them to evaluate the relevance of each item. I did a pilot test. At least I went to the field 2 weeks before the actual study, and then all the results were subjected to a reliability study. It is important, this having been a study, to say something about the ethical considerations that I used in my research. I sought a recommendation from the Research Ethics Committee of approval from UCU, from Mukono University. Somebody would be interested in why I didn't go for Makerere. Makerere was expensive. The ethics committee was expensive then, but I went in for this and it is acceptable. Then I also did adequate information. I gave the adequate information to the respondents. I assured them of I assured them of confidentiality. They also signed voluntary informed consent. Being that I don't have so much time, I think it's important that I say something about the findings on my objective 1. My objective one was to critically assess the legal provisions and their practical application pertaining to SRH in Uganda. And I looked at my legal framework here. I looked at the international, regional, and domestic level. And at the international level, I have highlighted the CEDAW, the Convention Against the Elimination of Discrimination Against Women. I've highlighted this because it is the most progressive law international document that speaks about the rights of women. But again, when you assess and look at all the provisions within this document, you know, they're talking about elimination of discrimination or elimination of discrimination against women generally. And like I stated earlier in my problem, that there are no intentional avenues or remedies that are directed to women accessing sexual and reproductive health while or given their status in polygamous marriages, something that I'm advocating for, or rather against, because for us in Uganda, as you're already aware, polygamy is provided for within Uganda's legal framework. It's provided for within Islam. It is provided for culturally. So polygamy is not something that is going to go away today or tomorrow. And I am saying that some of these laws, for example, the CEDAW committee, rather the CEDAW convention, need to be, or rather a country like Uganda needs to be very intentional. We are member states to CEDAW, be intentional, and, you know, maybe even go ahead and try to push for the amendment of some of these articles that are within the CEDAW that are not directly on access to sexual and reproductive health of women in polygamous marriages. But I also spoke about the Maputo Protocol. Maputo Protocol, this is the optional protocol to the African Charter on Human and People's Rights, on the rights of women. It is a little bit progressive on polygamy, but still, given even with its existence, still the findings show that women still face barriers. And also one thing about the Maputo Protocol, specifically for Uganda, and something that is very funny, like I've talked about the fact that polygamy is provided for within Uganda's legal framework. It is provided for within the Customary Marriages Registration Act. It's provided for within, among the Muslims, like it is acceptable. So somebody would expect that with such legal provisions, government goes ahead to come up with measures that protect these women's status in terms of accessing health care. But that is not, it's not anywhere within our legal framework. But again, we are a state party to the Maputo Protocol. But what happens for Article 14? Uganda goes ahead, or it went ahead and had a reservation on Article 14 specifically, which speaks about abortion. Personally, I wouldn't expect Uganda to have a reservation on Article 14, because what is provided for within Article 14 is actually provided for within Uganda's penal code from right away from section 121 all the way to 212. Then I looked at the challenges also and the legal and policy gaps that exist within Uganda's domestic laws. While Uganda, for example, under the constitution is very rich on the rights of women, there are still gaps in terms of implementing. We have a very progressive article 33.3, which states that it mandates Uganda or government to protect women and their maternal functions in society, a subject that we are speaking about rather today. We also have these rich articles like equality that speak about equality and non-discrimination. But still, my findings show that amidst or despite the existence of all this rich legal framework, we still have challenges. I will not share abortion right now, but I'll share later. Maybe Dr. Pamela, you'll give me some 5 or 10 minutes to share my findings on objective 2 and just conclude. My objective 2 was to assess the impact of polygamy on the realization of sexual and reproductive health of women in polygamous marriages. Like, you know, like the gist, the actual impact, what happens in polygamous marriages. The background, first of all, is the fact that there are organizations and stakeholders that have run to court in the past trying to challenge the existence of polygamy. And the available jurisprudence shows that courts have actually agreed that some practices within polygamy actually violate the rights of women. But again, courts in Uganda still have refused to outlaw to outlaw polygamy, something that I'm also in agreement, because like I stated earlier, polygamy is not something that you're going to do away with today, but how do you streamline it to see that women who are living in these polygamous unions can actually access sexual and reproductive health, despite the dynamics that exist therein. Then there are other challenges on things like in terms of economic, because if the wives are many and the breadwinner is one, therefore you don't expect him, the husband in this case, to be in position to support all the women who are trying to access sexual and reproductive health and rights. I have a quotation here from one third wife here in Namayingo district, and I quote her: "As the youngest wife, I am not allowed to access contraceptives. My right to make choices about my body is often overlooked because I am seen as the young one." While doing this research, I tried to also segment the number of wives, because like I stated earlier, it matters. The number you hold in polygamy is a determinant on how you're going to access sexual and reproductive health. There are challenges with other challenges, things like marital rape, and of course what comes out from such challenges, things like unwanted pregnancies, and of course the trauma. Just to show you here how I used the quantitative data in my work, and I'll show you just from 3 study areas. For example, if you look at male condoms here that I highlighted, at least 12% in one study area, 4% and 5.5% had knowledge or had used the male condom. Of course, this shows that discrepancy in terms of the men who have access to such information. But also, let me show you something here. The statistics on this shows the concerns of respondents on contraceptives, still at least in 3 study areas. When you look at the number of women who still wanted to have children, you can see the percentages: 79%, 66% in another area, 70%. So meaning all women in polygamous marriages want to have more children, because there's always that fight and competition of who should have how many children vis-a-vis the other. Again, when you look at I am opposed to family planning, you can see 21.2%, 37%, and then 19%. Then those who had ever experienced gender-based violence, I think UN Women has come out clearly to state that in every 3 women, there is 1 woman, at least, who has experienced either sexual, physical, or mental abuse in their lifetime. And when you look at these statistics here, you can clearly see 31.5 in one study area, 45.8, and 41.5 in another study area of women who had experienced gender-based violence. My last objective was to investigate the available measures and good practices that might be of relevance to improve sexual and reproductive health of men and women in polygamous marriages. And for me here, I want to just highlight one or 2 recommendations that I made. And my recommendation number 1 to government is there should be deliberate, and I'm very intentional on the words that I use in this study. There should be deliberate, intentional, and targeted legal interventions and strategies that respect culture and religious contexts. When I was interacting with the women in these polygamous setups, many of them confessed that there have not been direct avenues for them to access healthcare, especially the Muslim women. Whenever they go to hospitals, or rather to health centers, they are told that, those are Muslim women issues. They are not issues of all women. And like I stated earlier, that within a vulnerable group, there are always vulnerable groups. Within married women, there is also a vulnerable group in terms of accessing healthcare, which in this case are the women in polygamous marriages. But also, I think we need to start implementing the law either as is, or go ahead and actually make amendments with the intention to actually provide for the women that we are talking about today. Specifically, when you go in Uganda's constitution, Article 129, it mandates government to, or rather parliament, to come up with Sharia courts, with Qadi courts, so that they are in position to hear matters that relate to Muslims, maternal issues, which would include things like the subject we are discussing about today. The constitution we are talking about is a 1995 constitution. We are in 2024, and this article has never been implemented. The UN CEDAW committee in 2021 went ahead and passed concluding observations and advised government of Uganda to actually implement the courts. To date, these courts have not been implemented. So the Uganda Muslim Supreme Council went ahead and put up informal structures where Sharia courts sit informally. And when you I interacted with a number of judges, they have no information whatsoever about sexual and reproductive health and rights. Most of them, if in fact all of them, you saw in my introduction, 0.1% of them knew that there's actually SRH provided for within Islam. Majority of them, women have gone to these judges and they have deliberately refused to let them have access to some of the reproductive health matters like reproductive choice, things like abortion, because they believe that it is not acceptable in Islam. By way of what does this research bring on board? This study is very significant and it contributes to new knowledge by exploring the often overlooked intersection, like I said earlier, between polygamous marriages and the realization of SRH of women within these marriages. But also one thing about this study is the fact that it provides insights into how cultural, religious frameworks in polygamous unions directly impact women's access to reproductive health care. Thank you so much. I'm looking forward to interacting with all of you. Time is really against me, but I'll give details as we have this discussion today. Thank you so much. I hand over to you, Chairperson. Thank you so much.
Thank you very much, Mastullah, for taking us through your work. I will not waste time. I will go ahead and invite Dr. Swata to engage the candidate. Thank you.
Thank you very much, Chair. Mastullah, I would like to begin by acknowledging what you've done. It is not easy to critically look at one of the cultures, religions. Many people fear and they want to talk about the cultures of others. That you came out to investigate polygamous marriages within Islam or Muslim communities when you are Muslim. I think for me it is something critical and very important. Very many times people don't want to critique their cultures and religions. So I want to commend you for that for the beginning. Mastullah, you are aware that academic research emphasizes coherence and the consistency. And these are very pertinent issues for any academic work. I'd like you to go back and revisit your, if you can go to where your general objective and the specific objectives are. Please, are you there? You could even share so that we look at them together. I'm going to be interacting with you, so I'll be interacting. So what was your general objective, if you can remind me?
Thank you so much, Prof. My general objective was to look at the impact of polygamous marriages on women's realization of sexual and reproductive health and rights.
Okay, great. I'd like you to tell me how your first objective and the third objective reflect that general objective, if they rhyme well. If it's an impact study, and one would expect that the specific objectives help to achieve your general objective. I would like to read for us your first objective and the third, and tell me how it connects with your general objective.
Let me just retrieve it here. let me just extract it direct from the thesis because, okay, here. So my first objective is to critically assess the legal provisions and their practical application pertaining to sexual and reproductive health and rights. And you ask, how is this connected to my main objective? If you saw my discussion on what the problem is, there is no way I would have run straight to looking at the impact of polygamy on SRH of women in these setups, minus having to first assess what the legal framework is. But again, when you go ahead and look at the laws that have the legal framework that I tried to assess, you see a direct impact. You see how directly the legal framework impacts on women's sexual and reproductive health. I highlighted, for example, the Convention on the Elimination Against Discrimination Against Women, and in that law, in that CEDAW, when you look at the provisions, all of them are speaking about, there should be protection of women generally. Women should not be discriminated generally, but Uganda.
Regard Mastullah, you are introducing a new variable that is not part of your background variables in your title. And that's my concern, because now you are scattering the research to new variables that are not part of your original background variables. And I know you come from the legal probably background, but
Chair, I lost you. I can't hear, Prof. Dean, I can't hear you. Farouk, if you're there, I think you need to do something because I can hardly hear you.
are you back? I hope it's not the question that removed the network.
No. My network, Prof, is very stable. I think the problem is that side. Otherwise, my network is very stable. I beg your...
I had wanted to explain also the third objective before you go to the second. How is it contributing to the achievement of your general objective?
Thank you so much, Prof. In my third objective, I propose measures that would actually help access to sexual and reproductive health and rights of women in polygamous setups. From this third objective, I was also in position to come up with what this study actually contributes. And that's where I drew recommendations, for example, in terms of this research's contribution to the academia, but also to policy and the legal framework that would help us achieve what the independent variable, in this case, polygamy, and the dependent variable, which is reproductive health for women in polygamous setups.
So the two don't have anything to do with the impact of polygamy. And you went in the second objective and almost replicated your general objective in the second one without unpacking it. What's the difference between your second objective and the general objective, if you can tell me?
I think that was an oversight specifically for objective 2, in relation to the general objective. But in terms of objective 1 and objective 2, I tried to deeply show the direct connection between the direct connection.
Mastullah, you're defending an oversight because these are the objectives of your study, and you're telling me at this juncture that it was an oversight. And how do you convince us that it is an adequate study at this level of PhD when it's based on an oversight, Mastullah?
Thank you so much, Prof, for the guidance. But in terms of the content, and I think the challenge could be in the phraseology of the objective. But in terms of content, it is completely different. Like you have highlighted, as you can clearly see in objective 1, it is very clear. Even in my research problem, I highlight it. Even in the motivation of this study, I highlight why the legal framework has a direct implication or impact on women's realization of SRH. Again,
so you will have to work on the coherence and consistency throughout your work. Is very key for a research at this level. I want to go to another question, Mastullah. You seem to suggest in section 143 that multiple cohabitations are the same as polygamous marriages. And you even went ahead to select so many people who live in cohabitations and collected data that represent polygamous families. You are very well aware that by their stature, the cohabitations as de facto unions don't have the same commitments and structure as the polygamous marriages, even if they are polygamous, but there's more commitment, there are structures in which they work, unlike the cohabitations that you're talking about. And moreover, you're talking of a Muslim community that tends to be conservative when it comes to sexual issues. Then you go to collect data and you generalize it to polygamous marriages. How valid is the data that you went collecting? And how do you, mix up cohabitations and polygamous marriages, if you can explain?
Thank you so much, Prof. In my context of the study, I clearly explained what the scope of this research, of this study is. And I was very intentional why I brought in women and men who are cohabiting. And I was also very intentional in collecting data. One key thing that we might all be knowing is the fact that polygamy is not only practiced Islamically, or is not only influenced Islamically. Actually, even when it is influenced Islamically in some communities, polygamy continues or still remains to be deeply rooted within culture. And those who practice it do not wait to first go to formalize the institution. But them not being formalized legally does not actually take away their right to sexual and reproductive health and rights. Therefore, regardless of whether they are Muslim in nature in terms of the marriages that they are holding, or whether they are cohabiting, that does not take away. When you look at our constitution, even when you look at the national objectives of state, the direct and state policy, SRH is provided for. Even the CEDAW, for example, I've been highlighting here, even the Maputo Protocol, they provide for all of us to have access to health, and in this case, specifically to sexual and reproductive health. So for me, when I went to the field, I was very intentional on collecting data from even those who were cohabiting, because the practice is deeply rooted within culture and religion. That's why there are testimonies in my research from some of the respondents who were Christians but defined their husbands as Muslim, like with Muslimness in them, despite them not being Muslims.
Thank you, Mastullah. I told you in the research at this level, coherence and consistency are very, very important. You tell us in your title you're talking about polygamous marriages. Then you come to tell us that cohabitations are marriages. How do you define marriage? Because these are de facto unions which are loose, and actually in their very nature, they reject marriage as such. So when you mix them up at this level and you're just finding this, I don't know. How did you find marriage? Because there is monogamous, there are very many forms of marriage, but there is something that defines marriage and distinguishes it from other forms that are not marriage. And I think this is critical.
Thank you so much, Prof. I agree with you on the definition of polygamy as being, a union of man and woman, and, under the different marriages that are provided for within Uganda, polygamy being one of them. But again, also polygamy, like the case law that I was sharing with you here, for example, the Mifumi case, the case on law advocacy versus Attorney General, all of them do not look at polygamy as, on the polygamy that is recognized, for example, in the registration of customary registration marriages act, because it is a cultural practice. The women and men who practice polygamy do not, first of all, wait to go to church, because first of all, it is monogamous in its nature. They do not wait to go to the mosque. By the way, the findings show that even the Muslims who are in polygamy do not wait, first of all, to go to the mosque. And for me, my intention of this study is to contribute to knowledge and, try to cover up the policy gaps that exist when it comes to women who are in multiple marriages. You also saw on my definition of what polygamy is. While I am aware that the literal definition of polygamy, for example, it is inclusive of polyandry and polygyny. But here we are talking about polygamy, using polygamy, aware that actually polygamy means literally, it means polygyny. So depending on what I really wanted to achieve, but I'm very I take your recommendation on the different types of marriages that are provided for within Uganda. But my data captured all women who were living in multiple setups as marriages.
But Mastullah, you are not writing even only for the Ugandan audience. This is a PhD from a very reputable university. When people will hear you mentioning loose sexual relationships as marriages without looking at what really defines a marriage, I think for me it disturbs me. I'd like to take to another question. In your work, I've read different parts. You mention that you use the human rights-based approach. Some other times you say you use the rights-based approach. Are they the same things?
Yes, Prof. And when you look at the available literature, they are used interchangeably. The human rights approach and the human rights-based. Sometimes it is the human rights approach, other times it's the human rights-based approach, and other times it's the rights-based approach, Prof.
But you should have seen that some people distinguish the two. Did you find any literature that talks about the distinction between the two? Do they all use them interchangeably like you did in your work?
Yes, they might not be all, because like you're saying, and I'm learning from you, that not all available literature out there show that all the authors who opt to use the human rights-based approach, interchangeably use it. But in my literature review, all the references that I came up they use it interchangeably. But it is something that I can learn from and also be very keen on it for further studies.
Okay. Now that you want to get a PhD in human rights, I want to ask you a few questions in regard, and I'm glad to hear that you did this in a department of philosophy. You rightly mentioned in one section that sexual and reproductive health and rights is an aspect that is controversial, sensitive, and complex because of its nature, right? And because this is an academic environment, we shall not fear to interrogate on some of these controversies, and I want to interrogate you on some of them. I don't know whether you're aware, but you should be aware that human rights are first and foremost moral concepts before they become legal or social political concepts, because they are not mere anything, but they represent fundamental human values, of which they are a representation, a manifestation. So, and I'm not saying they don't have a legal or a social political dimension. Those are very fundamental, but before being those, they make reference to certain values. Now, when you read your work, there is a lot you talk about abortion. I was unlucky that you did not get a chance to talk about it. You mention abortion as a human right, and you repeatedly mention this in your work. And you're aware that this attempt to introduce abortion as a human right in the international arena began with both the Cairo and Beijing conferences of 1994 and 1995, respectively. But when you define human rights elsewhere, you argue that even these reproductive and sexual rights make reference to the right to life. So don't you think there is a contradiction? You are saying it's a fundamental right, and if the sexual and reproductive rights actually reinforce the fundamental rights, and you categorically mention this right to life, but then later on you are promoting a practice that is against the same fundamental value of life, and you call it a human right, and even you accuse the Ugandan government for not including it in its laws many times in your work. I want to hear from you. Do you think we're just dealing with materials, unborn babies, subjects of human rights, or they're just materials? And tell me who really qualifies as a subject of rights. Is it only adults? And what criteria do you use when two fundamental rights of life contradict, like in this case, maybe the woman and the child? I would like to hear from you.
Thank you so much, Prof. Of course, you're raising very pertinent issues here in regard to abortion. First of all, my work does not in any way advocate or recommend any illegality. My work recommends, gaps that are actually within the legal frameworks, of which, if they are to be implemented, they would still remain legal. Uganda, for example, specifically, we have a whole bill of rights, and it speaks about all of us as Ugandans. The abortion that I mentioned in my work, first of all, I'm very cognizant of the majority age, which is 18. So I'm not even speaking about abortion for underage girls. But again, when I also went to the field, and you'll see in one of the quantitative data that I have, I came across, can I call them women? Wives who were around 11 years. I have an age group of 10 to 19, girls of 19 years, girls of 15 who are actually wives. And when they are, these girls who are married at underage, they're not even talked about anywhere within our legal system. They are not, even me, myself, who is talking about them right now, I don't know whether they are still children, despite them having children, and, they are married, though the legal framework recognizes them as children, since they are still under 18. For me, I come from the background of what is provided within our legal framework. And what is provided for within our legal framework, I shared with us here. We have the penal code, which is for and against abortion at the same time. When you look at, I think, section 212, which gives the exceptions, the circumstances under which abortion can be conducted. For example, when the life of the baby is at risk, or when the life of the mother is at risk. In such circumstances, even when you go in my recommendations, I'm trying to push the government to come up with a procedural law on who should access abortion under Section 12411. But also my work is very sensitive on culture, aware that polygamy, like I have clearly and explicitly stated, that it's a cultural practice. It's provided for culturally and religiously, Islamically in this case. So there is no way I can push for something that I know the findings would actually contradict the whole study. Even still, when I go ahead in, maybe I could share with you a slide here. Yes, a slide here on Islam and polygamy. Maybe let me just share this one with on abortion, Islam and abortion. And I have a quotation here, for example, from Quran chapter 6, verses 51. People who have, or advocates against abortion, have claimed that Quran chapter 6, verses 151 is against abortion. And the verse reads, "And do not kill the soul for which Allah has forbidden." Allah is God, except by right. You can clearly see that in this, there is an exception. But this exception is not spoken about anywhere. Again, when you go into chapter 5, verse 32, it says that whoever kills a soul, unless for a soul. There is an exception here, unless for a soul. So unless for a soul is what? It is still actually what is embedded within our Section 212 of the Penal Code, the exception that gives a woman a right to go and have access to abortion if her life is if her life is at risk. But Prof, I also want maybe lastly to highlight that the usual recognized human rights principles, and specifically to highlight the fact, one principle, that human rights are actually interdependent. You cannot speak of do not take away, everybody has, like everyone has, for example, in the way it is provided for within our constitution, that nobody should be subjected to any form of discrimination. And then here we have, for example, Quranic provisions. We have also the Penal Code Act, which is also giving exceptions. But again, go ahead and not put up measures that would actually help these women access reproductive choice under abortion. So moving forward, Prof, the research is very sensitive. One, of the legal framework. I have not proposed any illegality, but I'm also very sensitive of the fact that polygamy is provided for culturally, deeply rooted in our culture, and also religiously. Thank you so much, Prof.
Thank you. When I was asking, I mentioned the right to life of the child. A very interesting issue there. When you say exception, does it mean it becomes a right? Because people extend this notion of right to everything, and you're aware that you cannot solve every problem with the notion of right. There are many ways you would solve this issue. And I hope you know, you come from the legal background, but you should have informed yourself also on the ethical discussions on this issue. You don't intentionally kill the child in exceptional cases, even there. But like I mentioned, this attempt to include the right to abortion, the discussion began, I hope you have interacted with the literature, in the two conferences, Beijing, Cairo, 1994, and then Beijing. That means it's a universal human right. But you seem to talk about the exceptional cases, but the debate is not even about the exception. And in your work, there is where you actually condemn, or you quote other scholars. That means you own there, because I saw the comments and I have the quotes here, where you are bashing the government for denying this. And you have said your work, okay, you are not targeting children, very interesting. But this makes me bring in the issue of I've read your work, and in several places you seem to suggest actually that these rights you're talking about, the sexual and reproductive rights, extend even to children, irrespective of their age. For instance, you mentioned a right-based approach to sexual and reproductive health is a conceptual framework promoting the protection, empowerment, and equality of all people, including young people, in all aspects of their lives, including their sexual lives. And later on, you say Article 34 guarantees children's rights, which can be interpreted to support access to comprehensive sexuality education, an important component of the SRHR. Now, I wanted to interrogate you on this, because you are aware that the content of this comprehensive sexual education to younger people has a genesis. And maybe that's why the Ugandan and African societies are rejecting it somewhere. Because the basic content is to enable them to have sex, as long as they avoid two evils, and you have consistently mentioned them in your work, unwanted pregnancies and sexually transmitted diseases. Otherwise, the proponents of it say the rest is okay, and even they say that it is wrong to stop young people from having sex. Some people like William Reich, the father of the sexual revolution, the recent, and even Herbert Malthus even argued that if children don't have sex, they have psychophysical problems. Yes, and you have seen for kids now to have sex without any restrictions in the name of sexual rights. And because this is behavioral, it's not merely only a healthy issue, I think this could explain the very problem that we have in society, and the urge for safe abortion, contraceptives, and family planning, and the measures like against STDs. So, and by the way, if you interact, and you should have interacted probably with some younger people, many of them have many psychophysical problems because of this bombardment. And very many younger people have problems. We are seeing a lot is happening, marriages are breaking, and you don't find some of the things in the mainstream literature and the media. So, could we be wrong to join the people who say these are pseudo rights? I want you to defend them as rights, given that they neither promote the well-being and dignity of their children, which human rights are meant to protect, and seem to jeopardize the collective good and responsibilities. I'd like you to defend these as real rights, basing on what the definition of human rights are. Do they apply to children, or they are contextualized?
Thank you so much, Prof. You raise key and pertinent issues in here, and you've made quite a number of comments. But before I even go to the issue of abortion and sexuality education for children, I think let me first comment on generally abortion, as you raised it, and how it is perceived at the international level, but also the child marriages that you then come to the child marriages that you speak about. First, I'll give an example of which I already shared, the legal framework pertaining abortion in Uganda, like the exceptions that are embedded within our penal code. If you look at the exception within Uganda's penal code, like as in the circumstances under which a woman can access abortion, and again the way the law is coiled under the Maputo Protocol in Article 14.2 is the same. But right now, Uganda has an exception, rather a reservation on the Maputo Protocol. And if you go ahead and ask why would we be having a reservation on a protocol that is meant to actually corroborate what is provided for within our penal code, you and I would not have the answer, but maybe the signatories to the Maputo Protocol who represented Uganda would know. The essence of advocating for these rights, it is not coming from a selfish angle, no. And also specifically for sexuality education. Sexuality education is, the gist of it is actually having access to information, not necessarily, to maybe meander and mislead the young people. But again, Prof, also one thing that came out from my findings is the fact that even when we have at least the legal framework that you and I know protects children, majority age being 18, we still have child marriages. We still have children who are mothers. We still have the COVID pandemic alone showed us what actually the reality in society. And then when it comes to us, the Muslims, we don't have a majority age, Prof. We do not have, and we are saying that, can children have access to information? I also just shared in this presentation that just 2 years ago, in the Marriage and Divorce of Mohammedans Act, there was a law that under Section 5 that allowed the registration of marriages of minors, Prof. And this has been done, for all this long until 2 years ago when somebody ran to court and, said that, this is unconstitutional. So for me, the advocating for sexuality education in my work is actually to come, push for it as a recommendation that I think would help protect the young girls who are the young mothers, the child mothers. And again, even when it comes to the concept of polygamy and its practice in all the study areas that I went to, these girls do not even consent to marriage, to these marriages. Like the way polygamy is practiced in these communities, it's like some form of cult, like, a following where you follow some supernatural being somewhere because you are even underage, you're naive, you end up, entering something that you do not know, and that it's going to affect your reproductive access to your reproductive health care. You also, yeah, I think that is it. Unless I have something that I have not addressed, I would be glad to be guided, Prof.
Thank you. I like your very positive approach to the sexuality education, but I want you to get time and go and look critically at the content, and you will agree with me where it comes from. And I think if you've been dealing with younger people, you see the impact. Very many young people even reach marriage life when they have exhausted everything, even weird things, because of this bombardment. And they're not calm, and it's true that we look at those international and regional instruments, but I think we need to have a critical look at them, because when you talk about sexuality education, our cultures and religions have had them, but they would receive what is given to each stage, not just bombarding people with everything, especially using the social media and other means. And this is critical. In Europe, they are very scared what children are consuming. Here we are wholesale taking everything. And I think for me, it is very critical. I'd like to ask you, you use the liberal feminist theory. I love it. And I think at its beginning, it and even up to now, it had a very legitimate cause, especially after the millennial discrimination of women in all forms. But then some, of course, when you want to change society, you have to use some radical ways, like you called it a radical feminism and all this. One of its proponents, an American philosopher, Simone de Beauvoir, said, the liberation of a woman will begin from the womb. Also associating it on the fact that women were excluded from working outside their homes because of small children and the repercussions we have seen in them. She had a point. But you, I'm sorry, maybe it may look personal, you as a Muslim, you mentioned it all yourself, a Muslim scholar on these issues. How do you take this radical view and you have seen some circles, people don't even want to have children because of what they have caused the women. How do you balance? How would one balance these values? Society needs children, but then it causes problems to the women. How do you balance the two in terms of also health and sexual and reproductive rights, like autonomy and all of this? I would like to hear from you on this.
Thanks. Let me see. How do I balance values of? Okay. Thank you so much, Prof. Yes, I want to confess again that yes, I'm a Muslim woman and I have lived Islam and practiced Islam, but I've also taken time to read about Islam. And when you look at the recommendations that I make in this study, I, for example, have a recommendation for religious leaders where I advocate for right interpretation of these religious texts, in this case, Islam. In Islam, we have the Quran and then Hadith, the teachings of Prophet Muhammad. And when you look at what is provided for within Islam, I shared with you here Quranic verses that are in for sexual and reproductive health. We have a surah or a chapter in the Quran. I think it is Surah Baqarah. It speaks about a lot. There's a lot that is spoken about in terms of sexual and reproductive health of women. Even the chapter that I shared with you here. There are even confessions from the Prophet Muhammad's time about sexual and reproductive health. There are confessions from him regarding how his what are caliphs called, his right-hand men, how they used to practice sexual and reproductive health for their women. For example, they used to do withdrawal method as a family planning method. But today, when you go, for example, to our Sharia courts that I shared with you here, the Qadi courts, when you go to mosques, there is no day you will go to a mosque and come and hear a sheikh or imam, speak about the rights of women in terms of accessing sexual and reproductive health. They just come out, like with blatant general statements that reproductive health, sexual and reproductive health is not acceptable. It's not provided for within Islam. And for me, I am coming up with recommendations under my objective 3 that we need intentional remedies, intentional avenues that address the challenges that we are talking about here. When I push, for example, for Article 129D, establishment of Qadi courts that I earlier talked about here, I am pushing for, can we have people who understand, first of all, Islam? Can we have sheikhs or imams or judges, in this case, Qadi judges, sitting in these Qadi courts, be trained on reproductive health? Can we also go ahead and train our culturalists, like at the grassroots, for example, because they hear these cases, Prof. Women go there when they have failed to access reproductive services. So in terms of balancing the values of society, I come from an advocacy angle where I am pushing for what is actually already in existence, for example, from the religious perspective, but is not being put in place. For example, the verses I put here, how I wish they would be published, for example, out there. Women would know, Muslim women would know that actually I can have access to abortion if my life is under threat. If a woman went and had abortion under that verse, if their life is at risk, if the life of the unborn child is at risk, I don't think society would come out and condemn her. Why? Because she's coming from an authoritative angle or from a legal angle where she's doing something that is acceptable. But again, like you're saying, society is society, and first of all, it is also patriarchal in nature, and it would want to disorganize and also not agree with what is already provided for the benefit of women. And that's where I go ahead and make recommendations, for example, that we need to train people, in this case, men who are in polygamous setups. When I read the literature, I saw literature that is relating, like literature on polygamy, and I saw some recommendations. One author was recommending that there should be gender norms training for men. And for me, in my research, I'm saying no. it shouldn't be just a blank statement of gender norms training. We need to get the men themselves in polygamous setups. Now, for example, with the research like mine, with this study here, which is giving us statistics of those who are in polygamy and how they are practicing it in terms of accessing SRH, can we have these men be the ambassadors themselves than just going to pick up men? You would end up picking a man who is patriarchal and who is against a woman who is a woman's access to sexual and reproductive health. And still, as I discuss this, I still insist that, or rather emphasize that polygamy is deeply rooted in culture. So if anything, then we have to look at culture, be very sensitive with culture, be very sensitive with religion, and try to balance the two. And of course, with the legal framework. Thank you, Prof.
Beginning exactly from there, one of the reasons of human rights research is to inform policy and decision making. And like you indicate, this is one of the reasons for your study. I would like you to look at the Ugandan situation. Uganda is a pluralistic society with the different cultures and religions, sometimes which even contradict each other, no? And like you mentioned in your work. There are even those who think that these rights, sexual and reproductive rights, are an imposition from outside. But you're also aware that we have cultural rights, we have religious rights, which are all fundamental rights, and individual rights. How would you, as an expert in human rights, recommend government to come up with the probably law, a national law framework that can accommodate all of these contradicting things? You're aware that human rights are, like you said, they're interdependent, they're indivisible and universal. How do you advise government? You already mentioned the domestic bill that has failed to come into law because of this pluralism of our society. How, as an expert and a scholar in human rights, would you advise? How could our society go about this? Do you create different laws like some have done for individuals, for individual groups, like probably the way of Engel had when he was talking about moral friends and moral enemies? Or you can come up with a national law that accommodates all, and what are the basis for coming up with such a law?
Thank you, Prof. Again, I want to say that polygamy is culturally provided for within our legal framework. But again, for example, if you read, I think Article 2 of the Constitution, there is a repugnance clause on Article 2, which states that any practice or any law that is inconsistent with Uganda's constitution, then that law would be null and void to the level of its inconsistency. We also have a law like the Customary Marriages Act. We have the Marriage and Divorce of Mohammedans Act. And like these are laws, Ugandan laws, acts of parliament. So clearly already you can see some willingness on the side of government to come up with laws that target specific groups. But also, I think it is Article 31 or Article 37 or 41 that give all of us a right to our beliefs, to our religion. So if I'm a Christian, if I'm a Muslim woman, and we wake up one morning to push for what has already been provided for within the Constitution, then I think we are not pushing for what is not already available. There is a bill, the Muslim Personal Law Bill, that has been on the shelves of Uganda's parliament for so long. But this bill is there because it derives its authenticity or originality from the Constitution itself under Article 129. So for me, I'm making recommendations after, combining what the legal framework is, looking at the policy gaps, but also going ahead to see what the findings in my study give. If, for example, when I interacted, I earlier shared here that when I interacted with the Sharia court judges, they clearly showed that they don't know what sexual and reproductive health and rights. They clearly showed that, Muslim women rights and reproductive health is some sort of, that it is alien to Muslim women. So when I come up and try to make a recommendation that actually we need to come up with Qadi courts or with Sharia courts, which by the way have also been recommended by the UN CEDAW committee if you look at the 2021 concluding observations. So I'm very, very culturally sensitive, but also very particular on what is embedded within the law vis-a-vis the groups of people that I am proposing to be targeted. But also, maybe if I can just add,
Yes, please.
I just wanted to add that I don't push that, every group should have their particular law. But in the event that that is needed to bring out the non-discrimination principle that is embedded within Uganda's legal framework per our constitution, then I think that wouldn't have any problem, Prof.
Okay, you make very strong claims and accusations of polygamy on a number of issues. For instance, you seem to suggest that there are more repeated pregnancies in polygamy, very closely spaced children, and so many other accusations you make throughout your work. And for me, this is a bit disturbing. You said science is very important in this. And there are even facts, biologic.
Chair, I can't hear Prof. Farouk, if you're there, I can't hear Prof.
So I was still explaining what our science brings us and the statistics. Because logically and biologically, when you have multiple wives, when one wife is ready for conception, probably you are with the number 3 or 4. And this explains in many polygamous families, the populations have remained low. I hope you have, this where you a bit hint on this, and I hope you know this fact. So when you come and accuse polygamous marriages for all of these multiple marriages and births, no spacing, and even the poverty, I don't know whether you control it for monogamous families, whether it's any different. Could there not be other intervening factors that lead to this instead of polygamy? Because how do you think whatever you said about the polygamous families applies to many monogamous families in Uganda? And worse still, for instance, the Christian monogamous families where there is no family planning, probably they will have even more children on the average. And you will realize that because of the strict and conservative Muslim laws, there are things that you cannot expect to find. And I think the ground is there, like the STDs, because Muslim women are strict. Their community is more strict, but you seem to show as though they are higher in terms of spread of STDs, poverty. Where I come from, in my village, majority of the people are Catholics and monogamous, but the polygamous Muslim families economically are a lot better than the Catholic families, and I really can't confirm. I don't know even whether you controlled for these other variables, because whatever variables you said there, they can actually apply to the monogamous Christian families in Uganda. I don't know, did you control, say that you don't make statements that can alarm people on these facts? How did you even control that these are peculiarly polygamous Muslim marriages are not probably caused? And secondly, I've seen the samples you did. Did you not find peculiarities in each of the regions of Uganda where you did this study? And if there, what could be the reason for probably the differences in the polygamous families in the different regions? Thank you.
Thank you so much, Prof. Maybe let me start with the last question. Of course, I found some peculiarities in the different within the different areas. I had 8 study areas. For example, if you look at these statistics, these are statistics from 3 different areas. And when maybe we could take those who use this table shows the current contraceptive use. And if you look at, for example, IUDs, in study area 1, it is 16%, and in another area, 15.1%. Then 19.4% for another area. And again, when you look at the respondents in terms of those who were in position to access contraceptives, still in 3 study areas, you can see some of the differences. Maybe we could talk about those who had ever aborted 14.6% in area 1 and 27.5% in area 2 and 29.5%. Some of the factors that influenced the difference, for example, in the statistics here, some are structural, but again, also some which are cultural. For example, you wouldn't expect statistics in Arua, for example, to be the same as statistics in Mukono. Yes, while there are quite a big number of Muslims in Mukono, but Arua and districts like Gomba have more Muslims than for example, Mukono. And you'll find that the Muslimness in Arua is way stronger in terms of polygamy and eventual impact to sexual and reproductive health, vis-a-vis a district that might not have that big number of Muslims. Thank you, Prof.
How did you measure the poverty level of people in the polygamous families?
I looked at I don't know if I could share with you a tool, but I looked, for example, I have statistics here. Yeah, this table. It shows responses from participants who had been, for example, 3 months before this data collection. And of course, there are reasons.
How did you collect those statistics? I'm interested. How, and is it even adequate? So you asked them to write something, I am poor, I am rich. How did you measure? How even are you sure that what they told you corresponds to the reality?
Prof, I had, of course, I had research tools. I earlier shared with you that I conducted, for example, 16 focus group discussions, which had at least 5 to 7 people. And all these,
we are poor, no? I said, oh, they are poor because they said we are poor. Why did you choose not to include the observation method? So that, because there are things you can see and then collaborate with what they tell you, but you deliberately excluded the observation method, and then you are here making, probably that's why you are claiming the Muslim polygamous families are poor when probably they are not.
Prof, this study was so much inclined to finding out the experiences that these women go through when they're trying to access sexual and reproductive health and rights. Observation would have, I think, helped me on getting information like health-related information in health centers, which wasn't also, by the way, available, including basic things like hospital records. Those were not available, even if I would have loved to use the observation method. But to answer your question, I used research methods that I knew would give me the results that I needed to answer the objectives, especially for objective 2. I needed focus group discussions, for example, for women to come up and testify. And that's why, even when I had 16 focus group discussions of 5 to 7 people, I went ahead out of the 124 people that had participated in the focus group discussion. I went ahead and again selected at least 40 of them, and again had interviews with them to get a feel of what they were going through. Then again, also for the men, I went ahead because the men refused to participate in focus group discussions, to discuss their, what they called their marital life. They deliberately refused to participate in focus group discussions. I considered them and took them and had case stories for men. So summarily, to answer your question, I could not have gone in for observation. It would not have given me the results.
The generalizations you make on what you did not say, I think, are misleading in that regard, on especially the economic status. If you think that observation was not necessary, then you should have concentrated on the things that don't need observation. If I may ask you lastly, what would you do differently if you had to conduct this research again?
I think I would, maybe I wouldn't do a similar research, but I would do a research that is so inclined to Muslim women and Islam. Look at the impact of Islam. Whereas in this research, I am looking at impact of polygamy on women who are living in polygamous.
Can you repeat? I missed some of the words.
Okay.
So,
Okay, thank you, Prof. I wouldn't do a similar study because that would be to discredit what these findings, yet they were actually validated and authentic. But I would do a study on the impact of Islam on access to sexual and reproductive health and rights of Muslim women, because this particular study is not deeply looking at Islam as a religion. It's rather looking at the Muslimness. And that's why I managed to bring in respondents who are also not Muslims, but living in communities and influenced by the Muslimness of those around them.
So this is a perfect study. You cannot repeat it because there's nothing to change, isn't it? That's what you're trying to confirm. Thank you, Mastullah. I want to hand you back to the chair.
Thank you so much, Prof.
Thank you very much, independent reader. Colleagues, let's give Dr. Swat a big round of applause for critically engaging the candidate. Thank you, Mastullah, for standing firm and responding to the questions. I'll now come to the panelists, and I would like to invite Professor Rukoko to ask his questions. So what we'll do, we'll have questions from 3 panelists, and then we'll give the candidate opportunity to respond, and then move on that way. Thank you.
Thank you, Chair. Thank you, Chair. And thank you, Mastullah, for the effort, first of all, to write this dissertation, but also for defending what you put on paper. And I want to say that a number of things which I wanted to say or want to raise have been raised by the independent reader, otherwise known as advocatus diabolic. But I want to start with moral issues. One, you started with using the terms, the phrase health and rights, as if they are separated. Then later on, you talk of reproductive health rights. I am wondering whether you wanted to keep them separate or whether they can be combined, because you have reproductive health and rights and then health rights. And to varies, initially you start with that health and rights, but then increasingly you focus on health rights, reproductive health rights. Is that, what do you lose if you omit the word and consistently, so that you are consistent throughout?
Thank you so much.
Ask you more questions? Okay.
Yeah, it's better maybe if we get to other questions, then we'll give opportunity to respond, if that is okay with you, Prof.
Okay, let me ask another one. I looked at your work, but one of the glaring things that is in your work is too many recommendations which you generate at the end. Do you think these recommendations are derived from your study, or you just felt that they should be there, or would they rather be in the main body of the text? Why should we have too many recommendations which are not exactly being discussed in the main body of the dissertation? Then maybe the third one, but I was concerned with objectives really also, but I think it has been discussed, so maybe I should leave them at that stage. But I also have another query. Let us look at page 5. Page 5 of your work. I don't know whether the dissertation has changed.
Yes, Prof.
Are you there?
Yes, Prof.
Maybe similar to what the independent reader was pointing out. You give us certain statistics, but this looks like a rumor. Where did you pick, for example, polygamy present in 78% of the world's cultures? Where did you pick that? Why difference, so that we can understand this better? I think since other people have questioned, let me leave it at that, because there could be very many, and I am not the only one. Thank you, Chair.
Mastullah, maybe you respond to Professor's questions because they're very specific. And do you want to go ahead and respond?
Yes, Prof. Thank you so much, Professor Rukoko.
Frozen again.
Can you hear me?
So if she's frozen, it means she can. Okay. So could you please respond to the questions?
Thank you so much, Dr. Pamela, and thank you so much, Professor Rukoko, for the questions. I'll end with the last one. Rather, I'll start with the last question. Where did I get 78% in world is culture? There's an authority to that. I can say I didn't put it right away after citing the percentage, but in my presentation, it is. I highlighted it. I think it is the Lancet or some institute in the US. I can always share, but there is an authority to that, Professor Rukoko.
Saying it is also reflected in other parts of the text, but I'm saying that in particular is not referenced. So yes. Where did you get? But proceed.
No, Professor, I take note of that, and I should be in position to reference it in the final report that I'll submit to the university. And then why not? There are too many recommendations. Why don't we put them in the body? First of all, of course, there are too many recommendations also highlight the problem that we are discussing today. Culture is not culture and religion. Like I stated, it is some tricky area that you wouldn't give, for example, one recommendation to handle sexual and reproductive health related issues, and moreover matters which are very sensitive, in this case being to women. So given the problems or the challenges that I got in regard to assessing the impact of women in polygamous marriages, informed my coming up with the too many recommendations. However, in the event that I'm to move forward with this report, I would try maybe to remove some recommendations from and just maybe include them in the body of the report. But there is no recommendation which is proposed and not in line with the findings of the study. Then why not omit the word and? Prof, at international standards like SRH it is sexual reproductive health and rights. The and brings in, like the other rights which are interrelated to sexual and reproductive health. Previously, it was only sexual and reproductive health. As of now, it is sexual reproductive health and rights per the World Health Organization.
Yes, but then why are you not consistent? That is the issue.
I think you take note of that comment, Mastullah, that you're not consistent. So if you choose to do one thing, you stick to that. You can't be using it differently on one page and then you get to another line and you're saying something else. So I think just take the point of consistency. Thank you.
Yes, Prof. I take note of that.
Okay. May I invite Dr. Christine Mpiango to engage the candidate?
Mastullah, thank you for giving us a busy morning. Yeah, and I would like to join the opponent to thank you for daring to look at yourself as a Muslim woman, but also a Muslim scholar who now brings fresh reflections to this very important topic. I want to confine myself to some of the things that you've talked about with the opponent that re-triggered my own reflection. It seems that in our own cultures, religions, there are some apparatus that maybe we expect should protect the young ones, the children, but instead, the men see these young ones as women. Just this weekend here in Uganda, I don't know where you are, whether you saw, there was a rumor of a big person who was reported to be in a relationship with an S3 girl. I scanned the social media and some of the responses from men disappointed me. To the extent that some were saying, even me, I would have been taken up. Even the judge could have had a problem dealing with this matter. There is a behavior, a sexual behavior that I don't seem to appreciate in our own societies. And for me sitting here and discussing and discussing sexual rights, legal frameworks. I think it's also an opportunity for us to think if, and then we have pictures of a girl or girls, whether true or not, flying around. So you can see that I'm trying to actually contextualize. So that's why I personally don't think it is not true that you didn't find girls who are in relationships that call them married women. So it's a problem. It's a dilemma. So, and then I think at some point, the critical reader at least thinks that we consume everything, but maybe in Europe, things are better or there's more protection, which I don't really properly agree with, because again, there's a lot of men and reports. Recently, I was doing a trauma, a trauma session, and many participants were victims of sexual relations with very close people who were men, including fathers. So, what is it in our culture? What is it in our humanity about sex that doesn't seem to control itself when it comes to sex? That whether it's children or older people, we actually succumb. So I think that you have given us an opportunity to reflect. My question in that regard, what do you think in the communities where you went, what do you think could be the problem? Are men afraid of older women? Why do they have, and what are the authorities? Since you also have the legal background, what are the authorities in those communities where you found young ladies, young children, children, people categorized as children? When you said 11 years, I was a little confused, but you said you've met children in marriage relationships. What are the authorities doing at that? Because I think your work should actually begin right there in those communities. Secondly, it seems we live with a definition of marriage, but we act away from that definition. These children, are they given out? Are they given out? Do they just run away from home? Has anybody followed up on this to really cause an issue regarding their existence or regarding their living in such a context? My other concern was on the health rights and health and rights, which you have articulated after Professor Rukoko. So, kindly just highlight about two very unique challenges, because you also talked about the unique challenges in these marriages. To single out like only two specific unique challenges that you think you found in the polygamous marriages with regard to access. Because I'm trying to understand, is it that they are not allowed to access, or is it that there is a hindrance there's something they lack to be able to access the sexual reproductive health services? And by the way, do they even know them? Do they know those services? When I read your work, I do think about one challenge for me in a polygamous marriage would be how long it takes for an individual wife to enjoy sex, actually.
Yeah.
Is that a right?
I can't hear Dr. Mpiangu. I think she's off.
3 or number 4?
Chair, I can't hear Dr. Mpiangu. I see her speak, but I can't hear her.
Mastullah, I am
Yes.
not going off. I'm just sticking to the whole thing of sexual rights. Yeah. How long is how many nights? What happens in between? So for me, I think that the ethics, the rights should, what does the law say about that consummation and as a right? And what does our culture enhance that or inhibit? And what did the women say about that? For example, the young women, do they even know such a thing as rights? And finally, when talking about sexual rights, sexual health, I don't remember in one of your recommendations. Are there such things as, did you find such frameworks as regards sex education, like at an earlier age? At what point should these things be, should sexual health, reproductive health and rights be passed on in the community? And then there is also a tendency of our cultures setting the girl child up for marriage in terms of sex, but I don't think they're doing the same in equal measure to the boy child. Are there, because I saw some people saying the girls are affordable, the women are affordable. Because if you approach a girl, a woman that you want to have as a wife from a perspective of she's affordable, maybe because you bought a sanitary towel, maybe because you provided a small gift, when are you going to allow her a voice to tell you whether she wants to have sex with you or not, or whether she wants to have another child or not? And is there even room to discuss that it's not necessary to compete to have so many children because of what that means? Because if a girl is married off at 13 and there's competition for children and they are 5 in a marriage relationship, when do these things evolve, and how did those communities really? I'm interested in that engagement, especially with the stakeholders. And if I don't know if you were able to really have that focus group and the wealth of information that would enrich your recommendation, so that there is some form of action, not just at national level or frameworks and all that, but also push for engagement at Mukono, at Uyikwe, in Arua. I would like to see that galvanized into something very prescriptive for the community, or them to tell us what they could do to prepare to prepare the communities to respond better to some of these things that you are raising. Thank you. Back to Chair.
Thank you very much, Dr. Mpiangu. I think I changed my original plan. Mastullah, could you please respond to the questions? Because I think they might pile and come too many, then it will be difficult for her to respond. So if you can be precise in your response.
Thank you so much, Chair, and thank you so much, Dr. Mpiangu. Dr. Mpiang raises almost all my research findings are embedded within Dr. Mpiangu's questions and her comments. And maybe let me start with the last question. Did I find any frameworks such as maybe sex or reproductive health for these women at an early age? I'm glad that Dr. Mpiang again also gave the answer to this question that, these girls are only given this information when they are going to marry them off. As you are well already aware that most cultures within Uganda have these sessions, which are also termed as Senga sessions for women who are intending to marry. So yes, the only sex-related sessions that I came across are those ones where these girls are nurtured into early marriages. In fact, they are also recommended or advised to get married at any early stage. But also Dr. Mpiangu asks a question on what happens in terms of the nights, the nights, what happens to these women? One key finding that I've came across is the issue of early menopause. Infidelity is a very, a big challenge. And I think I could even share with you a slide here. Just a second, Chair.
I think you can just explain because time. Okay. Mm-hmm.
Okay, Doctor, thank you so much. When you look at these statistics in terms of the level of infidelity in polygamous marriages, for example, females who had been married at the age of 18 to 25, at least 1.5 reported sex with more than one partner in the past year than the women aged between 40 to 49. Then also females in polygamous marriages in urban areas slightly reported sex with multiple partners in the past year relative to their rural counterparts with a percentage of 2.1% compared to this. Then we also have a percentage of 2.1% here of females who reported sex with multiple partners. So you can clearly see that, the level of multiple sex partners is quite high. What brings this is the absence of husbands. And also the other challenge that comes from the absence of husbands is the early menopause for these women, because the husband is there, and therefore what happens next? The women become infertile. What's the problem? Professor Dr. Mpiangu asks, what is the problem? The problem is what we are discussing here, Dr. Mpiangu, and all these factors that you are raising. The problem is big. The problem is cultural. The problem is religious. I will highlight just one case maybe to answer this. You spoke of a social media case, a recent social media case, but there's also another recent social media case where there are allegations against one man who is accused of having sexually abused his stepdaughter. And you saw the remarks that came from a would-be stakeholder to protect this girl. You had the Deputy Mufti of Uganda, I think he's the ex-Deputy Mufti. He recommended first to the mother of this girl that Islam protects, that this woman should not have come out, first of all, to speak. And these are comments which are coming from an authority that is from an institution that is supposed to protect a Muslim woman somewhere. Again, we had similar remarks where they're urging this woman to withdraw the case because Islam protects. And these are the recommendations that I make, for example, in this regard, that these religious leaders need actual capacity building so that they can be in position to interpret Islam, interpret religious texts in ways which are progressive, but also in ways which are real as they are provided for within, for example, the Quran and all the Prophet's sayings. And again, maybe also to just back up of what happens. There is work that has been written by Professor Ross in the United States, and there is a famous quote from her. She says that women in polygamous marriages get a fraction of the husband. Like every woman gets just a fraction. So you don't have the whole, the husband is not entirely, entirely to you. You get a fraction of him, which also explains the broader problem that we are grappling with for women who are trying to access reproductive health. I think that is it from Dr. Mpiango, unless there's something that I have left out. Otherwise, thank you so much.
Thank you, Mastullah. We're learning a lot. I like the bit of the fractions. I will now invite Dr. Lawrence Branco.
Thank you, Chair. And thank you, Mastullah, for the informative session you have shared with us. I want also to first commend you for the effort you have invested in this work. Putting aside the issues we are trying to pose to you to address, I think I can feel some level of motivation and I think passion, although sometimes it might go beyond the academic discourse in terms of debate, but I love the passion and enthusiasm. Thank you and congratulations so far. Let me begin by actually looking at the topic. I'm also a little concerned about why you use the word a case of Uganda, because in terms of scope, you and I and everyone here knows that I think you didn't invest all your time in the entire Uganda boundaries. You are very categorical that you were in selected districts of Uganda. By including the word a case of Uganda at the end of your topic, for the first read, it sounds very ambitious and unrealistic. I would recommend that maybe you look at that and either drop that and revise the topic to either read and say in selected districts of Uganda as opposed to a case of Uganda. Otherwise, the scope sounds vague and too big for comprehension, at least academically. We need to be a little bit more specific. Number two, still in regard to the topic, and of course moving forward to the objective, which I don't want to discuss so much in detail because our independent reader gave I'm not sure how you go about that legal thing because it's a variable that we don't seem to read from the title. And maybe my colleagues would guide more, but the very first objective to read as the legal, it throws some bit of confusion. It's not so big, but it puts us in a different spectrum. Whether we are looking at the legal as is it the legal issue you are looking at or the impact in another aspects of, yeah. So think about that, either to modify that and replace the legal, or even just throw it away completely and discuss it in the body. I understand the legality of this matter, but I'm also concerned about highlighting it as part of the objective, especially even number one, where I would have expected you to bounce on the very key and unpack it fully. So moving forward, I am also looking at your scope in relation, of course, again, to the title. So if you clarified the scope a bit more in the topic, then I would not have so much problem with that. Moving forward, you mentioned somewhere that you presumed that in the districts where you surveyed, that's where there is the highest concentration of Muslim community. But you are very careful to call it presumption.
And I'm very curious to know whether after you conduct this study, that presumption turned out to be true or false. Because since it's a presumption, we want you to be very categorical somewhere in your body of work and say, well, whereas it was assumed that these districts had probably the highest number of Muslim community, it turned out not to be the right thing. It doesn't mean you are wrong. It just means that you are just true to the data that you are presenting to us, and it's believability that we are looking at here, as opposed to just being silent on that important matter. Moving forward, on page 64, 65, 66, I appreciate the qualitative presentation, especially on the demographics of the study participants. But usually when you're presenting data qualitatively, you either use tablature or text, but you seem to be telling us already what we see in the tablatures in words. So you are just not saying anything new. Usually what we would require is just to tell us what do those figures mean, what do those percentages mean, beyond just telling us 67% or 50%. We can read the data, trust us, but we would want a little bit of more. What do they mean? Do they imply something beyond just being a figure? And I would argue that you go throughout all your work where you present quantitative data to ensure, I know in some places you do, but be consistent and ensure that you let us know what do those results mean. I mean, I'm talking about the percentages that you present. Otherwise, the quantitative presentation would be hanging in balance. Okay, I just want to move forward also. From your interactions, again, this is curiosity. Did you get a sense from your interaction that polygamy is sort of synonymous to abuse of sexual rights and SRHR? Because it seems to be assumed that it's the polygamy that is the cause of these abuse, and I'm not sure whether that is supported by data, because there could be other confounding variables, influences, but I'm not sure it's just a causal effect issue. So that has to be very clearly defined. I'm not very sure you can actually defend that polygamy is necessarily the cause of these. It could be just part of a debate that probably polygamy has an impact, but to be emphatic on that as a causal effect can be a problematic statement. And I appreciate that you had focus group discussions. The independent reader was curious why you were very categorical to exclude the observation methods. But along these lines, I'm very curious, how did you triangulate your data sets for validation? If you only chose to use only these selected, how did they inform the validity of that? When I read your work, it didn't seem to come out very clearly, but probably to defend, you need to give some bit of more statements on that. And finally, or second last, is the page 268. I think it's about to do with your recommendations, right? 268. I think you're making a very interesting recommendation here. Let me just get that page to be sure I'm referring to what you are talking about, the CADI courts. By formalizing CADI courts within Uganda's legal framework, women in Muslim communities, especially those in polygamous marriages, can gain access to a structured, recognized system. Now, but back, let's go, just moving backward, you mentioned that actually you also looked at non-Muslim families, but as long as they are living in a Muslim community, right? You're not exclusive to Muslims as a religion, but Muslim community. I'm curious if the card courts would also be subjected. I mean, these are the women who are not necessarily subscribed to Muslim as a religion would be subscribed to card courts. Or this is just for, because I know card courts are for Muslims, right? As a religion, not as a community. So when you make it as a recommendation here, I get concerned whether you are aware that there is also a right for
I think it's frozen. Okay, you're back now. Okay, would you please respond to the concerns of the Dr. Sekalega?
Oh, yes, thank you so much, Chair, and thank you so much, Dr. Sekalega. Maybe can I also start with the last question? Would the non-Muslim women also access the Qadi courts? I think such a recommendation, first of all, would save the broader Muslim community and specifically the women who are even right now in the informal status of the available Qadi courts. The Muslim women are the largest litigants in these in the existing informal Qadi courts. So in terms of jurisdiction, of course, the way the Constitution is crafted in Article 1291D, it is explicit for Muslims, for people who are for Muslims generally. But this being a structure or an institution that we are trying to propose, and it's to propose, even right now in the informal state, there are Christian women who go to these Qadi courts. I interacted with the imams, with the Qadi judges, with these women who have gone to Qadi courts to access reproductive health. But also in terms of jurisdiction, I think that is a matter that would be determined by Parliament. But as from me, of course, again, coming from a legal background, I don't want to come here and say that, I would recommend Christian women, for example, to go to Qadi courts. But if they subscribe to the religion and the law says as such, then that I wouldn't really have a problem with that. My issue here is having institutions that can actually go ahead and help these women access reproductive health. Even right now, like I stated in my findings, these women were describing, for example, in the focus group discussions that I held, they were describing their husbands as Muslims, yet in reality they're not Muslims. So that is a matter that would be determined by Parliament, but I know it would absolutely help these women, regardless of whether they're Christians or not, because even right now they still access these courts to resolve their SRH related problems. There is a question on whether polygamy is autonomous and whether there are other, I think, causes that impede women's access to sexual and reproductive health. Absolutely, Doctor, yes. There are other challenges. There are other challenges that impede women's access to sexual and reproductive health and rights. And I don't want to go into them, though they were also highlighted challenges, for example, like the economic implications or economic status of these women and their husbands. But my research also, as you can see, the topic was on the impact. My interest was on looking at what does polygamy do to women in the search of sexual and reproductive health and rights. Absolutely, there are so many factors that affect women, that stop women from accessing sexual and reproductive health, some of which have been highlighted even by the panel here. And again, even some others that I didn't look at that could not be captured within this study. I have gone ahead and recommended them in areas for further study. The case of Uganda sounds unrealistic. Yes, doctor. I absolutely take note of that comment, saying that Uganda is, I know while I looked at 8 districts, yeah, I agree it is not representative of the entire population of Uganda. I know even right now we have some new statistics from the Uganda Bureau of Statistics, the 2023 population census. I don't want to comment about it, but yes, I take note of the, I will look for how I can rephrase it to get rid of Uganda. Then I think again, even the second comment was still on the topic on how I can try to clarify the scope in the topic. Okay, there is a comment, I think, on the scope. Doctor, I want to state that the presumption was not on their conduct, rather on I didn't presume before going to the field that people who live in these communities are Muslims. No, the presumption was on the Muslimness, on their conduct, like how they conduct themselves, not necessarily that I presumed that they are Muslims. If I did that, then absolutely I would have come out with wrong findings. But the presumption was on the Muslimness because of the number of Muslims within these communities, and that the statistics is already within the Uganda Bureau of Statistics reports. Even the 2023 report shows the number of Muslims and which districts have majority Muslims. And you also ask a question: do the findings confirm this presumption? I want to say the findings confirm the Muslimness of the people who live within the majority Muslim areas, their conduct in terms of accessing sexual and reproductive health. And yes, I think that is it. Thank you so much, Doctor.
Thank you, Mastullah. I am not sure that Dr. Sekalega is satisfied with your response. Not that I'm going to give him a chance to ask another question, but I think that one of the things he wanted you to speak to directly, and I've tried to reformulate this. So what exactly is the correlation between polygamous marriages and women's right to sexual reproductive health? Dr. Branco, did I get it? So that is the question, because that is the focus of the study, and I think what he wanted you to say in one word or two was to say, well, polygamous marriages do ABCD to women's rights to sexual reproductive health. Do they give the women access? Does it deny them? You can reflect on that. And of course, also when you talk about the Muslimness, not the Muslim numbers, but the Muslimness, it's also something you might have to explain for people who are really not familiar with this study because they don't get the difference. But I'll go ahead and ask the next panelist to ask their questions. We can come back to those later. So may I now ask Dr. Edgar Taylor to please engage the candidate.
Sure. Thank you very much. And my apologies that I was in another meeting this morning. And so I came in as you were engaging with the opponent. So my apologies if my questions have already been addressed in one way or another. But I think, like others, I think I find the study very, very interesting in how and in the questions that you're addressing. And I want to go back to just pick up actually on, I think, where the previous discussion has left off about what is specific or how you're conceptualizing the boundaries of community and in relation to rights and health. So I appreciated the discussion at the beginning about insisting on an idea of community rather than identity, because of course all identities are formed in relation to other other people, and I think a lot of what you're describing in the thesis is both about the dynamics of individuals seeking reproductive health at an individual or family level, but also issues that would require legal or institutional change, and that comes partly through advocacy and community building. So it brought to my mind in the late 1950s, early 1960s, that the only organization that worked across racial lines politically and succeeded in advocacy was a women's group seeking for the rights to divorce, inheritance, and health for Hindu Indian women, and that was led by people like Rebecca Mulira, Barbara Sabin, and a cross-racial group. So that's a long way of introducing my question, which is about what is the role of non-Muslim women or advocates, or even non-women, that is men, in these discussions and advocacy for rights to reproductive health. So that's my first question about what if you're making a claim, and I'm not going to wade into that question about what is specific to the Muslim community or not, but if you're making a claim that the advocacy is for particular conditions of Muslim women, that what is the role of others, of Christians, of others who are from not necessarily part of that community? Do they have a role in advocacy? And then my second question is about the idea of rights. So I think it came up in an earlier question. I didn't quite note it down, but the idea of rights changes over time, and often what the sort of legalistic formulation of rights is very different from the way people talk about rights on the ground in their own languages, in their own contexts. And so I wonder if you could say something about beyond the idea of rights to reproductive health as is the actual words and language that women in Muslim communities use to talk about their right to access certain reproductive health. So it reminds me of a literature on political rights in Uganda that by Mikkel Karlstrom, who emphasizes that often the translation of the idea of rights is often much more specific or has other connotations than it does in a legalistic framework in English. And so I wonder if you could talk about that specificity as well. Thank you.
Mastullah, we're back to you.
Thank you so much, Dr. Edgar. I'll start with the first question. The role of non-Muslim advocates in, I think, is it in the advocacy of SRH or rights generally?
I think it's either direction you want to take, either in the broader, I mean, it's up to you how you want to frame that, whether it's in the broader advocacy world or whether it's the grounded community level.
I think for me, the role of other advocates or stakeholders, it might not even be inclined to this study, but also after having worked with civil society and academia for now, the role of the non-Muslims, like in this case, cannot be done away with. And again, still you see in my recommendations, still I again emphasize that, we need ambassadors, we need key stakeholders to do this, to do advocacy for purposes of changing the gender norms and, the gender attitudes for women. So yes, I agree with you highly that the non-Muslims could and can play a great role in terms of sensitizing, creating awareness, coming up with research. During my interviews, and I think especially focus group discussion, and also even the case stories, for example, with the CAD judges, like I shared with you, these CAD judges could not tell, I said this earlier, they don't know what is provided for within the Quran that they preach to people. They don't know that actually reproductive health is done. And I go ahead in my recommendations that are specific to civil society organizations. I ask civil society organizations, one, to publish a lot about these rights. How I wish, for example, we came out and, published maybe a whole chapter that speaks about the rights of sexual reproductive health of Muslim women as provided for within Islam or within the Quran specifically. That would help, one, the women who are trying to access sexual and reproductive health, but also build the capacity of these ambassadors who are not necessarily Muslims, but also the creating awareness, like what we are doing this session. Definitely, I'm sure there are people who will walk out of this session today knowing that there are Muslim women who also have access to sexual and reproductive health as provided for within Islam. Then what do rights mean to the Muslim women? I think, I interacted with different groups of women, but the majority were the rural women, like women in the rural setups. And for them, what rights mean to them, they're not even demanding for so much, really. They're demanding for the obvious things like reproductive choice, somebody just being in position to have, body autonomy, have access to deciding that, I can have the number of children I want. I think I didn't reach, there is a slide I have in my PowerPoint where a woman is testifying that on the day she was supposed to give birth, she drove herself to hospital while bleeding. And where was the husband? The husband had an anniversary somewhere with the third wife. And the Muslim women are demanding for, so I don't think that is too much for a husband who woke up and, made vows, for example, to go and, marry this woman. I don't think that would be so much to drive their wives or, to the health center to give birth. And remember, the same husbands are the ones who put too much pressure on all the women that I interacted. These husbands put too much pressure on the number of children that these women should have. So in terms of what rights mean to the Muslim women that I interacted with, they are asking for reproductive choice, having, that bodily autonomy, having access to economic activities. The biggest percentage of all the respondents that I interacted with all the women, majority of them do not work. The only breadwinner in these communities, or rather in these families, is the husband who has multiple wives and has to take care of all of the women, which obviously has a direct impact on women's access to sexual and reproductive health and rights. Thank you so much, Doctor.
I'll just follow up to say, I think it's important to pay attention to the specific language that they use. Are they saying dembe la, or are they talking about specific instances? I know it's a major, politically, it's an important move to sort of translate those demands into a language of like bodily autonomy, or in my country, in the United States, there's this new phrase, reproductive freedom, has been a way that they, for decades, they were talking about using a different language, and it was like about right to abortion, and people were very nervous about that. So I think it would be very interesting to think about what is the language that individual women are using to describe what they want, and how that's getting translated into the legalistic framework. And I think in terms of advocacy, that's just a really important dimension that I think you're really well positioned to be looking into.
Thank you.
All right. Thank you very much. May I now invite Dr. Martin Chamanywa to engage the candidate? What did you say? Oh, okay. I will not forget anybody. I promise.
Thank you, Chair. Thank you, Mastullah. I congratulate you upon reaching this stage. It has been a while since I last saw you, I think when you were our student in the Bachelor of Development Studies class. Happy to see you. I'll have just a few comments, questions, because most of the things have been addressed. The first one, on your methodology, on page 56, you talk about psychometric tests and then work sampling. I would like you to explain to us more how you applied them in your study. And then in the focus group discussions, you said that the numbers were 5 to 7 members. Don't you think 5 is on the lower side? Were you able to capture all the dynamics from the groups that had 5 members? And you being a Muslim now, and you tell us that you engage so much with the Muslim and Muslimness, that kind of concept. How were you able to separate your own experiences from your findings? From your own findings. Otherwise, you might end up, disappearing in your own findings. And finally, what do you consider to be the major contribution that your study has come up with? I thank you.
Thank you so much, Martin, and also happy to see you. It's been a while since I did my bachelor's in development studies. First, I speak about the psychometric test and how did I apply them. Psychometric tests, these are tests which are done like to test the intellectual capacity of someone, and in this case of the respondent. And like I said, I had a tool that I pre-tested before going to the field, and this was done 2 weeks before, whereby I of course, together with my research assistants, we translated the tool into knowing whether the respondents could actually understand what I was talking about in terms of sexual reproductive health. So yes, the psychometric tests were designed specifically to understand whether the respondents had the intellectual capacity to understand the subject that I was discussing. Then in terms of, yes, being a Muslim woman and how am I in position to separate my experiences, I think, from the findings. Of course, you can see in my methodology, first, I'm not a respondent, but also all the data, you can see it's a replica of the findings that I came up with. Maybe my being a Muslim woman is, I think it only motivated, it like coming from the ontological aspect, like I could have had it like as that, yes, that is reality, but what happens in the field? And when I went to the field, some of my fears were actually confirmed. So they are not in any way related to my findings. Thank you so much, Martin.
There was a break. We didn't hear what those fears were. Would you just kindly repeat that, the fears that you had about your Muslimness as you went to the field?
I had a fear, for example, the wrong interpretation of religious texts. There is that general perception that Muslim women do not have rights, first of all, generally, but also now in regard to sexual and reproductive health and rights that, Islam does not provide, for example, for access to sexual and reproductive health and rights. And indeed, when I went to the field, I came across Qadi judges that have been speaking about in this discussion today, that they actually confirmed that, Muslim women do not have that right whatsoever provided for religiously. So that was confirmed as one of the fears that I had.
Okay, thank you very much. Dr. Markwa, I haven't forgotten you. I just wanted you to come last on this panel and give us some entertainment.
Yeah, thank you so much, Madam Chair. And also thank you so much, Mastullah. I know it is not easy to come up with such a big volume. So I really appreciate. I have about 2 questions because most of my questions are asked. And I want to begin with a disclaimer. I am not a polygamous man. But no, I'm not responding to the chair, but I'm trying to connect that to my question. You seem to really have a lot of accusations against polygamy, as the independent reader put it. Because when you talk about polygamy being something against the rights of women, especially towards how many children they are supposed to have, that it is actually a space for dictating to them that they should have a lot of children. I think that is a misrepresentation. I want to give you an example. I know my friend who has many wives. He has about 5 women. And when this woman says that the other one is pregnant, you see a kind of competition amongst the women. So you will find out that when children, like the firstborn of this woman and the firstborn of this other one and the firstborn of this one, they are almost the same age, like few months. They are actually, as you are saying, if they are 2, they will be twins. So I think polygamy gives women a chance actually to go against the rights of men. These men don't want, polygamous men, I'm sure they don't, according to the experience, they don't want those so many children. But it is the women who use that space, because if your friend has 5 and for you have 1, it is like you are passing a vote of no confidence in yourself. So that is where I wanted to begin from. I will want your comment also on that. And when you say polygamous homes are like a source of sexual transmitted infections, and you blame it on men, I'm wondering, how do you determine in a polygamous home that a man is the one who brought this disease in the home? How? Do you have any data to really justify that? And actually, I see this as a contradiction to your presentation, because you are saying polygamous homes or families. Your data, actually, you are finding one of them is that those women have multiple partners. They are really going with so many other men outside the marriage. And now you say the men are bringing sicknesses, and the sexually transmitted infection is attributed to these men. I feel that is really unfair to them. And finally, my question is about literature review. I have seen you have consulted a lot of literature, which is very good, but I want you to place your work along that trajectory of the many scholars you have consulted. Where does your work sit along that kind of trajectory? Thank you so much.
Thank you, Dr. Mastullah.
Thank you so much, Dr. Kanakwa, and thank you so much, Dr. Pamela. First comment, I think it was a comment, but I could also maybe say something about it on misrepresentation of, I think, the power dynamics in polygamous setups. I think, Doctor, it is not in dispute that, there are power dynamics within polygamous marriages, being that here we are having the man who is the polygamist versus his multiple wives. That already somebody having more than one wife is already, it's already power. We are not talking about polyandry. Of course, if we were talking about polyandry, then we would position such a woman also to be having, you know, power within her husband. So it is a given. And Doctor, I think I do not, in my findings, I do not blame men for, I don't put infidelity only on men. Even the statistics that I showed on one slide here show the multiple sexual networks among all the partners. Even the wives themselves are having more than one partner. And I remember also showing here that some of the causes of the early menopause for women is because of the absence of the husband. So while the husband is with wife A, then the other wives would be also looking out for some other partners. Then yes, I also agree that yeah, I consulted quite a number of literature. Yes, where do I place my work along that trajectory of I think this is, maybe I would answer it even in terms of the contribution of this work that I have already spoken about in Martini's question. This is new empirical research that brings out the uniqueness and the intersection of one religion and moreover Islam, but also the concept of human rights. You know, when you're discussing religious aspects, usually they will not want you to bring out, you know, like a human rights-based approach, which I bring out highly in this research. But also coming from Uganda, which is not even a majority Muslim country, but with majority, with some sections of majority Muslims. So I think in terms of where I place my work, it is new research that brings out the intersection of gender, you know, religion, even the legal aspect, and sexual and reproductive health and rights, and all religion. Thank you.
Thank you very much, Mastullah, for your response. I think that there is a question that Dr. Makwa asked, and you answer one side of it in where you agree that indeed your data does not blame men. But then, Dr. Makwa, is there a section in the work that the candidate actually blames things like STDs and all that on the men? Because then that would be helpful for her to sort of clean that out so that there's consistency. Again, thank you.
Yeah, I think I have to check because I'm told this is not the version of the book which she has. Yeah, so I don't want to confuse her. But there are those sparks of the tone of the language is showing that men in polygamous families or marriages are the cause of problems like sexual infections. And for me, by the way, I like polygamous men than, yeah, because for them, they come out in the open. They do the things in the open. Someone says, I have 5 women, and he has them. But someone pretends that he has one, and yet they have 100. Then,
thank you, Mastullah, for standing firm and calm through this session. I have, I think, one question, maybe 2, that I would like to ask. So there was a question on how your Muslimness affected or did not affect your research. And I think this really is a question of positionality. if you had gone to the field to collect data and you were not a Muslim, would the findings, for example, have been different? So in other words, the people you're able to speak to and how open they are to you, is that in any way influenced by who you are? Do these women, particularly the Muslim women, see that they are speaking to a fellow Muslim woman and they can, share their problems, their concerns more openly than if they would have done had it been a Catholic nun conducting that research? So I thought you needed to be a little bit more clear on that. And then I'm also wondering, so you focused on multiple districts in Uganda. And I'm wondering if you changed the districts, if I took your study and replaced those districts with another set of districts in Uganda, what would be different? In other words, I'm asking for the specifics from these districts. What is unique? Is this a kind of study that I would just take as a generic thing, simply take out Wikwe and put there Bududa, take out this and put there something else, and claim that the data that I have is actually from those other districts? I'd like to hear your thoughts on that.
Thank you so much, Dr. Pamela. Maybe I start with the first question. Would the findings be different if I were not a Muslim? No, the findings would not be different from if I hadn't been a Muslim. If I were a Christian, still I would come up with the same findings, because the findings are a replica of what people's experiences are in the areas of study. And maybe I would just be shocked because I would be seeing some of the things for the first time. But now, being a Muslim woman and who has seen polygamy, that polygamy is practiced within Muslims, like I went to the field knowing that actually polygamy is, to some extent spoken about within the Muslim. So that would shock a Christian who goes to do research within a Muslim community. But in terms of the findings, they would be the same. Then if you change the district, would that be different? I think you would absolutely get the difference in the statistics, the number of people, for example, the number of respondents who are practicing polygamy. You wouldn't come up with these high numbers. And even when you just look at the Uganda National Bureau of Statistics and the standards reports, you can see that there are a big number of Muslims within these communities. And remember now, what even makes it worse to have more polygamy in these districts is the fact that it is being practiced, under two dynamics: the culture, the cultural aspect, and also the religious aspect. In some areas which are not Muslim dominated, polygamy is practiced, but only culturally, not because they are Muslims. Thank you so much, Doctor.
All right, and maybe a last one, which is a question that has come from one of the groups here, is whether so should we take it that in this study you largely it's a study about Muslim women, or is it just polygamous marriages? And I'm asking this because one of the questions I have been asked is why I do not have critical scholars of Islam on this panel. And what informed my choice of the panel was the topic of study. And in this topic, even in the abstract, the word Muslim or Islam does not appear anywhere. So I can defend myself why. But then you can see the conversation is very much around Muslims. So I'm just curious to hear from you so that I'm also safe. Thank you.
I beg your pardon, Dr. Pamela? I didn't hear the first part of the question.
The question was, so is this a study on Muslim women in polygamous relationships or polygamous marriages? Or is it a study on polygamous marriages, generally beyond Muslims?
Thank you so much, Doctor. The study is beyond Muslims, and that's why we have respondents who are not Muslims. Dr. Pamela, I can't hear you.
Okay, so I thought maybe the Muslim sort of captured. You don't hear me? Okay, it's internet.
I cannot hear you.
No, so I was just saying that because the conversation here has taken on very much the angle and direction of Muslim women and Muslimness, of even the non-Muslims, and even the non-Muslim women talked about their husbands were like Muslim or Muslimness. So those are a bit slippery for some of us to understand. So if as a Christian woman, someone says their husband is like a Muslim or a Muslimness, I don't know what exactly do they mean. These are things that, just for public consumption, I would like you to make clear, because I think somewhere you said something like that about I forget where I wrote the comment, but you talked about the non-Muslim women talking about their husbands either being like Muslims, they're not Muslims, but they're like Muslims. And what does that mean? Again, in the spirit of the questions that Dr. Edgar Taylor asked you, which language are people using? So the sort of terms that they use mean a lot to you as a researcher. Can you just throw some light on that?
Thank you so much, Dr. Pamela. I think you're meaning the Muslimness, and some of the women or the wives who call them their husbands as who refer to them as Muslims in certain aspects. You realize that a big number of the respondents, of the wives or women, had been married, not necessarily, while I know that yes, polygamy, there's a Christian man who will marry multiple wives basing on culture, and culture not necessarily Islam. But within the study areas, there are men Christian men, for example, who married women, not even basing on culture, but basing on those around them, which was even the major influence for those who were not Muslims, but basing on, the relationship, for example, that they have with the Muslims who had more than one wife. I think, is it Dr. I think Dr. Kanakwa, if I remember so well, who is for polygamy, telling you how he's, how he loves men who are polygamous.
Mastullah, I just wanted you to say, when the Christians women say that their husbands are as Muslims, what do they mean? That is just what I want, like in 2 words. Are they saying that they also have more than one wife? That is
exactly.
Yeah, that's what I needed. Okay, thank you. Okay, I'll now open up to the audience, both here and online. Farouk, I don't read the comments. I can't read the comments, but I have 2 hands. Dr. Dixon Kanaklia, and then Eric Jemba will ask the next question.
Thank you, Mastullah, for the work so far done. When you come in at the tail end, all the questions have been asked, and it's very difficult. So what I'm going to get a tone of suggesting some changes to the work. So one, this has already been raised, please. I think the title has to be adjusted. Because when the critical reader asked you about the issue of marriage, I wasn't satisfied with your answer. It was vague, and being a legal scholar, that was unbecoming of you, because there's a technical definition of marriage. So maybe you could add and relationships, probably. It's you to think about with your supervisor, and or relationships or couples, something like that, so that you can capture even those who are multiple partner relationships. So that if we say marriage and then you bring in If you bring someone who married a Yankee, that is like a defilement, isn't it? So it goes beyond marriage. So I think you have to think about that. And the reason why this became a problem to you, because in the work, I didn't find you taking time to define marriage. As a scholar at this level, you should clear the concepts. And you understand that the concept of marriage in Africa is not the way we define it. Define it just about economic interests and so on and so forth. Some men are even donated women, they donate them to them. So it's not just about sex. It goes beyond, and it's also a moral question. So you need to clearly take some space in your work and define this concept marriage so that the reader understands from what perspective you're analyzing it. So that the critical reader wouldn't have had trouble to ask you such a question if you had done that. And then going back to the question of abortion, which they raised here, and that is, I wanted to take it categorically. As a teacher of human rights, there is no right called a right to abortion. You cannot cite any national instrument in Uganda where it is written there is a right to abortion. This is an activist language. It's not a scholarly language. You are creating something that does not exist. Maybe you could say a suggested right to abortion. Use such a language. Otherwise, people will accuse your work for being an illegality. As the critical reader raised it, you are promoting something that can even lead to your arrest, because in Uganda it's not allowed. Moreover, a scholar at PhD level, you keep referring to a right to abortion. It doesn't exist. And you need to really clarify that. Where you use it, maybe put a footnote or something and say this is a suggested what? Right, which could be codified in our laws or something like that. So be clear on that so that you don't come in, the answer you are giving came from an activist language. You're trying to defend what actually legally doesn't do what? Exist. Then I want only one or two things to end this. There is a problem, and I think it also came from what the reader mentioned. When you talk, one of the components of the sexual and reproductive health rights is the promotion of information sharing about sexuality. Now, the danger of sexualization of minors is a big problem. I know Dr. Mpiango is concerned about young people. She only looked at it from the big man who was dating a senior 3 girl. What if this girl is already sexualized by accessing information that you should not have access at a tender what? Tender age. So there's a danger that if you promote these sexual and reproductive rights, you didn't look at the other side, that it can sexualize the young people. Actually, they're the ones sometimes who initiate. We have a problem here in Makere. You have heard of sexual harassment and all those things. There's a side that people silently don't talk about. Some of these students are more sexual than the lecturers, because they have been sexualized at a tender what? Age. They come and entice the lecturer, and the community always blames the what? The lecturer. So the community blames the men. Why are they dating these young girls? But what if the girl has already been accessed wrong, or let's not say wrong, but information that shouldn't have access at an early what? Age, which is a very serious concern. And in your work, it doesn't come up. Then finally, you didn't help us to define the concept health. This is what I'm talking about, that in your preliminary pages, explain this concept as the way you are using them in the work. One of the key concepts in your work is health. What is health? What kind of approach are you using, definition are you using? If you go to WHO, the definition is broad. It even includes mental health. It includes so many other aspects of what? Health. And you need also to examine it from that angle. What if, because data shows that more and more women are getting mental disorders, is that a result of polygamy or there's something else? So you need also to conceptualize this idea so that when you are using them, we understand. Actually, sexual and reproductive health is a sub-right under the right to health. Although they write about it as a standalone right, but it actually falls under the right to what? To health. And we need also to broaden our definition so that when you're discussing it, you're looking at the different angles. I know this may be too late to revise that, but it would have been reflected in your tool so that you look at the different aspects of health. So that because sexual health has a very big bearing on mental and psychological what? Health. Then the last thing that I want to advise when you're writing your abstract, what Dr. Sekalega raised, give us the overall finding. The overall finding should be what relationship did you find between the two main variables, that is polygamous marriages and the right to what? Sexual reproductive health. Is it a direct relationship? Is it an inverse relationship? Is it a symmetrical relationship? What did you find? What is the final thing you found? He was asking you that does polygamy directly lead to denial of women's right to sexual and health rights, reproductive rights? So in your abstract, that should come out as so that you tell us what is the main finding, and that's what Dr. Martin was saying. What is the significant finding you got that the work is putting across? Thank you very much.
Yeah, I'm going to respond. Mastullah, just hold on. You'll pick the questions and then you'll respond, and I'll tell you when to respond.
Thank you, Madam Chair. Congratulations, my former classmate, because now you are plotting to be promoted from our class to another class. Mine is about two issues. The one that you talked about of the lady driving to the labor ward. That is what my concern, and the other is about, can there be an allowance to adjust the objective? Rooted in, let me start with the second one. Rooted with the contestation that I have had, that I've experienced the opponent with you, that the content, some content is not rhyming well with one of the objectives. At this level, can Mastullah be allowed to adjust or edit one objective to suit the content? I'm done with that, but going back to the first one, what's the opposite of a disclaimer? A claimer. Madam Chair, I claim to be having more than one wives, and I was not comfortable when my colleague explained that issue in a way of a tragedy, that this man is going for an anniversary and the woman is driving to the labor ward. I'm wondering who bought that car that this lady is driving. So being a polygamous man, I am experienced of the claim that my colleague is saying that majority of the wives are not breadwinners. Yet, in the current Uganda, for all of us polygamous men, have enabled our wives to be bread earners. So there's a tendency of saying that we are not responsible, we are not giving care, yet we have done it so well in others' perspectives. So my friend Mastullah, I wish those voices are also addressed for our own rights. Thank you, Chair.
Okay, thank you very much, Eric. Biamjenzi, I can't read the other name, but your hand is up. Biamjenzi Hamid, can you please unmute and ask your question?
Yes, thank you, Professor. Good afternoon. Let me hope I'm audible. I want to thank you for this opportunity. I have two quick ones. One is on the quotation from Quran. First of all, I'm a student of Religion and Peace Studies. I come a PhD student from the Department of Religion and Peace Studies with bias in Islamic Studies. And my reminder to the sister is on Quran chapter 6, verse 51, which she mentioned about abortion. General abortion, 80% of the Muslim scholars disregard it. It's not permitted. And the exceptional issue she mentioned wasn't explained. And two, cohabitation is not considered as a form of marriage. It is considered as zina, fornication. Those are the two comments I wanted to raise. Thank you so much, and I wish her success.
Thank you very much, Hamid. Fatuma? Fatuma, your hand is up. Please unmute and ask your question.
Thank you so much for the opportunity. I also thank the presenter for her elaborate presentation. Mine is one. I would like to ask for Mastullah's position on polygamous marriages. What is her position? Can she also share more on the recommendation about Uganda implementing the FEDO and decolonizing SRHR policies? I hope she got it clearly.
Thank you. Hopefully she has. Mastullah, you can now respond to some of those comments and questions asked where you can.
Some of these questions. Can I edit one objective to suit the content?
Yeah.
Yes, Dr. Pamela, can I proceed?
Please do.
Okay,
Please
thank
do.
you so much. I think there is a comment where I don't know, the gentleman didn't mention his name, but the one who says that I'm his OB, he says that he's not comfortable when I make, I think, assertions that I think the comment I made, or the quote I made from my findings, that there was a woman who drove herself to hospital, and then the husband at the time was going for an anniversary, for the anniversary of the third wife. And then he also asks who bought that car. And I don't want to go into that discussion, but already it is a patriarchal question, really, that actually highlights and confirms the findings of my study, where still, the presumption is that women do not work, which I think is wrong. But again, I also don't want to run away from the fact that women in polygamous marriage, especially those are interviewed, do not work. But the issue here is not on who bought the car. The issue is the reproductive issue here, that we have somebody who is at the verge of giving birth, and in this case, life and death, and then we have to celebrate an anniversary somewhere. Clearly such a finding shows the intersection that we are trying to discuss, the relationship, the power dynamics in polygamous marriage when it comes to accessing reproductive health. But again, I also want to take it as a recommendation for the study when he confesses that he's one of the few polygamous men who are good. I think we would need a study that looks at maybe the good practices within polygamy, and then I want to think we would come across such respondents like him. Then I think Hamid made that a comment on abortion, and he says that a majority of scholars do not agree with abortion. I think it is really not authentic, because over 90% of the schools of thought, the Malik school of thought, the Hanafis, all of them agree, for example, that in Islam, a woman can have an abortion, for example, as long as it is within the 120 days, what is called ensoulment, or sanctuary of life. I think those are the only comments, Doctor. Unless I have something I have left, then I would be guided. Oh, Fatuma's question. Yes, there's Fatuma's question. She asks what is my position on abortion? Sorry, on polygamy. Of course, while I discuss the findings of polygamy, the impact of polygamy on sexual and reproductive health and rights, I do not put anywhere in my work that I am against polygamy. I am aware that this is a practice that is deeply rooted within culture and religion. And that's why I go ahead to push for laws that are very intentional with specific avenues of handling sexual and reproductive health and rights for women in polygamous marriages. I think she also asks on the last part of the question on should we amend, I think, the CEDAW, push for CEDAW. Yes, I earlier on shared that there is a reservation. Uganda has a reservation, for example, on Article 14 of the Maputo Protocol, which is in relationship to abortion. And for me, I would highly push for the amendment of the CEDAW. Why not? Because this is, I think, a document that we ratified, I think, in 1985, and we're in 2024. Of course, there's a lot that has changed. And if we are speaking about sexual and reproductive health access for women in polygamous marriages, and we find that even the legal framework that we are relying on is not handling what we are trying to push for, then absolutely at the international level, I would gladly push for the amendment of the Convention on the Elimination of Discrimination Against Women. Then I think I want to say something about Dr. Kanakulia's comments, if I may, Dr. Pamela.
Please do. Go ahead.
Thank you so much. He define marriage. Yes, I take note of that comment, Doctor. And then I think it is interesting how Dr. Kanakulia says that I'm trying to push for an illegality. Doctor, no, I'm not pushing for an illegality in any way. But and I'm also not coming from an activist angle to push for abortion. No, I'm actually coming from the legal point of view as provided under section, I think 121 all the way to 21, section 141 of the Penal Code. Then section specifically, my pushing for abortion is embedded within section 212 of the Penal Code, which gives the exceptions under which a woman can have abortion. And in this, the Penal Code is very express that a woman can have access to abortion if the life of the baby is at risk and or if her health is at risk. And that's what I'm pushing for. We don't want to see women dying when even their pregnancies are they are very complicated and complex, and the law is very clear. So if this research is coming out to push for procedural rules and laws to define who should access, or rather, how should we access abortion services under section 1214, then I think that's not any illegality. It's already provided for within Uganda's law, and in this case specifically under the Penal Code. But being that the research also looks at the Islamic concept or Islamic angle of reproductive health, I think still, again, in regard to Dr. Kanakulia's submission, I think still we would want to know if I'm trying to push for, again, for an illegality under Islam. And it has also been raised by, I think, one speaker, Hamid. And I want to say that still Islam it's not against abortion entirely. In fact, when you look at the Islamic provisions on sexual and reproductive health, and specifically on abortion, vis-a-vis what is provided within Uganda's law under the Penal Code, it is in tandem, and that's what I'm trying to push for. A woman who cannot access abortion Islamically should be in position to access abortion legally or culturally. Thank you so much.
Okay. Thank you very much, Mastullah. I would like to bring this session to a temporary close. I want to thank you for standing or sitting firm through all these hours and responding to the questions, and also to thank my colleagues here for all they've done and listened into you attentively. So at this point, colleagues, I would like to request that anybody other than the panelists should take a break. The panelists will remain in here to take a decision. Professor Farouk, come and help me to make sure that everybody online. Yes, so Mastullah, you stay on, but you're not participating in the discussion. Farouk is going to take care of that to make sure that you guys online are not following our conversation here. Are we all back to the house? Waiting for Mama. Okay. All right. Mastullah.
Yes,
Hello,
colleagues.
hello, Mastullah.
I'm here.
I want to be sure that you're there.
I'm here, doctor.
You're there and fine. Okay, we are okay and we are ready to proceed, but we are waiting for Mommy to come back into the room.
Thank you.
Okay, good afternoon, colleagues, both here physically and online. And good, I'm sure it's good morning for you, Mastullah, wherever you are. We enjoyed listening to your presentation, and I personally picked one thing, this quote that you took from some book where you say that so all women in polygamous relationships just have a fraction of a man, right? And then and I remember some African American friend of mine was told me one time that when she went to her grandmother complaining about her husband, who she suspected to have multiple or to be in multiple relationships, and that her grandmother told her that a fraction of a man is better than nothing. So I I don't know. I don't know what Mastullah would do with that kind of debate. But anyway, we have deliberated, Mastullah, and I want to tell you that the panel is very satisfied that you did well and you passed. Many congratulations. Many congratulations. That said, there is no academic work that is perfect and ready to go 100%. There's always room for improvement. And so this panel strongly feels that there are sections of this work that you need to address before we can accept and submit it to the Directorate of Research and Graduate Training for you to be awarded the Doctor of Philosophy degree of Makerere University. One, and I suspect that you'll have, you already suspect which areas need adjustment because of the heated yeah, it's okay. Okay, sorry. Okay, so here are the areas. One is the title. I think you listened to various suggestions on how you could tweak the title. So would like you to revise that title to reflect what you actually have in the dissertation. 2, you should articulate the problem, because I think what you had is more of a statement and there are multiple things. So the question is, what is it exactly that you went out to investigate? So I would like you to state the problem very, very precisely. You should also refine the objectives. So refine the objectives of the study to reflect what is in the dissertation. And here you might want to recall from your classes of research when you're doing human rights, I suppose, that the general objective of the study must be derived from the title of the study, so that the general objective speaks to the title, and then the specific objectives also emerge out of the general objective. So again, there were those concerns, and we'll need you to refine these objectives so that they're more systematic and more clear to the readers. And also, as you get to the conclusions, again, it's the same. If you have objective A in your study, by the time we get to the conclusion, what is your conclusion relating to that specific objective? And that is what, the issue of coherence and consistency. We want you to take us, you say you're taking us on a path from Makerere to Masaka, and we want to go to Masaka, not somewhere again, go to Soroti, go this way. We want the path to be clear. And the only way for you to do that is to make sure that all these things are aligned. Now, there was, of course, concern with the recommendations, that you have a whole near chapter on recommendations, and this should not be the case, because the recommendations here come out of what you went to investigate. So if the problem was X, Y, Z, after collecting data and analyzing data on that particular problem, what recommendation do you come up with? And so the recommendation should really be precise, and they should speak to what you went to do. Otherwise, you could tell us everything and anything, and that doesn't help. Okay, you also need to clarify the terms. I think several terms were asked here, health, marriage. So you need to clarify how you use these terms, and you need to clarify the scope. Because in as much as you say it is women in polygamous relationship, but the conversation seems to very much rotate around Muslim women. So we want you to rethink this and decide whether it is this or that. And if it is both, then the presentation should be balanced all through the dissertation. Okay, and then the structure of the dissertation. This is something, again, you'll work with whoever will be in charge of, and I'll come back to that. But we want you to make your dissertation more systematic. So and we could see that from the presentation, that if it is on the methodology, focus on the methodology consistently and let it flow logically. So when you get to the other chapters, do the same, so that the readers don't get confused when you seem to move from one thing to another without clear signposting. The work, of course, needs close editing before we accept to have it on our shelves here. So once you've done all the corrections, you need to get someone who is not too close to this work to read it and help you edit. Many times, because we are not native speakers of English, we tend to write as though we're conversing, and when we do that, the meaning gets lost. So you need to have the work edited. Also, there's a concern about referencing all the material that you've used. And there were sections where you're being asked, where did you get the statistics from, or where do you pick this from? And that information is not provided in the book. So can you take the responsibility to make sure that when you provide work, when you provide statements that originate from somewhere else, you actually acknowledge where you're getting that information from so that you're not accused of plagiarism. I think those were the key issues. My colleagues on the panel, if there's something I've forgotten, please be kind enough to help me raise that. And then, okay, so you will get, okay, so you're going to get the minutes of this Viva together with another examination report, which we received after we had shared the previous two. And then you have up to 3 months to address those comments. And I know that you have your two supervisors who have since left Makerere University, but you closely work with them. But nonetheless, we have decided that Professor Rukoko will oversee, so that in the event that you submit the work and the compliance report doesn't reflect that you've addressed these issues, the person who would hold the responsible would be Professor Rukoko. He will oversee the corrections. So you'll get a copy of the minutes. You'll get a copy of the other report that you did not have. You will even get some of the precise comments raised by the independent reader. And then when you revise, you supply us with a compliance report explaining how you have addressed these questions. And with that, I would like to bring this to an end, of course, by congratulating you, congratulating the parents, congratulating your supervisors, congratulating the department. Let's clap for all of them. And yes, I give you a few minutes if you have anything that you would like to say to us here.
Thank you so much, Dr. Pamela, and the distinguished panelists. I also want to thank my supervisors. Unfortunately, they're not on this call. And thank my family. I can see my dad and my mom and my siblings are in the room, and some friends. And then, of course, the esteemed guests. I also want to say that I have a very strong support system that is watching and following closely virtually. Thank you so much. Today marks a very significant milestone, and I am deeply grateful for the opportunity to share this moment with all of you. Defending my PhD has been a very challenging yet incredibly fulfilling. I extend my heartfelt appreciation to the panelists for sparing your time to come here and to give me the guidance through this process. The Dean, thank you so much for listening to me. Thank you for letting me defend virtually. To my children, my siblings, and all my friends for all your unwavering support. To my parents, my dad, I can see him here on screen. Growing up, he was a very, very tough dad known in the whole village. And because of him, I am today getting this title because of my dad and my mom. Thank you so much for your love, for your belief in me. This has made this achievement possible. I am immensely appreciative of all of you who have given me support to, to study and do this PhD. Thank you so much for being a part of this journey. I am very, very, very passionate about the rights of women, and I'm very intentional about the recommendations and the areas that I propose for further study. I want to think that my work contributes meaningfully to our collective understanding and also for the benefit of most vulnerable women. My PhD journey has been successful and has successfully ended today. Thank you so much for being part of my PhD journey. Thank you so much.
Okay, congratulations again. Please don't leave because we need to take some photos. So yeah, we'll take virtual photos. So I'll ask your parents to come to the screen so that you're in between. You know, these moments, you won't capture them again. You'll be talking about other things. But for now, we'd like to take some photos. So I ask. I have a photo with the family and then members of the panel. Okay, that's good. Mastullah, you're at an angle. How do you? Yes, that. Yeah, keep there. Relax. Okay. For the brother. Yeah, beside there. Yeah. Yeah, that's okay. I'll send you the ones I took. The line is too much. Okay, panelists, please, a picture with the candidate. I mean, not a candidate anymore. She's not a candidate anymore. Yes. Farouk, come and organize that.
We need to be organized.
Mastullah, focus for one more.
Sorry.
All right.
Smile.
Thank you very much. Mastullah, we don't know where the party will be, but an end, and we are closing from this side. Bye.
Bye. Thank you so much, Doctor.
Congratulations.
So much. Thank you so much.
Yeah.